treatment, but 90% of Dr. Lederman's patients with breast cancer were keeping their breasts. Dr. Lederman, an outspoken advocate of breast-saving therapy, educated women about choices. To arm every woman about breast cancer, choices, breast-saving whenever possible and desired. When every hospital thought standard radiation was okay, Dr. Lederman had a better idea. Innovative Dr. Lederman first brought brain radiosurgery to New York and body radiosurgery to America. Meet Dr. Lederman, breast-conserving therapy over decades. 1384 Broadway at 38th. Call 212-CHOICES. 212-CHOICES about breast cancer treatment. Most insurances, Medicare, Medicaid accepted. For a fresh second opinion, call Dr. Lederman. Breast cancer treatment, call 212-CHOICES. 212-CHOICES. Call Dr. Lederman today. 212-CHOICES.
Many people with cancer come to Dr. Lederman when surgery didn't help and toxic chemo stopped working. Many come in pain. Many people with cancer come to Dr. Lederman when their caregiver has no more care to offer. Dr. Lederman, bringing innovative cancer care for decades. When the next cancer drug is not as promised, when surgery was the failed pass, we may be able to offer you new cancer treatment options. We treat new and recurrent cancers, small or large, most anywhere in the body, even if prior chemo, radiation, or surgery didn't work. Call Dr. Lederman, 212-CHOICES, 212-CHOICES for a free booklet DVD. 38th and Broadway. Most insurances, Medicare, Medicaid accepted. Harvard-trained, triple board certified Dr. Lederman, 212-CHOICES, 212-CHOICES for innovative cancer treatment. Best is to meet Dr. Lederman in person. Call 212-CHOICES, 212-CHOICES.
We're back. I want to talk about a 60-year-old man who has a high PSA. His PSA has been up to 20. He's had 3 biopsies of the prostate. None show cancer. He hasn't had anything done in a year and a half. He came in. He's very worried about having cancer, and he should be worried because about 50% of men with his PSA will have prostate cancer. Just because the doctor stuck a needle in doesn't mean he got the cancer. So this is a man who's had prostate biopsy before, but the PSA keeps on rising. So it's highly worrisome for cancer. And, of course, we arranged to get the blood test immediately, and he'll be back the beginning of the week to go over the results and then talk about all the options of diagnosis and treatment. But we like to get blood tests. We like to give you copies of them so you can exactly see what's going on in your life or your loved one's life. And I want to talk about a woman who is 59 years old. She has 4 children. She's a widow. And she had an ultrasound of her breast, and she was told that she had nothing. She saw a mammogram, she saw doctors, but they told her she had nothing. So they sent her home, but she knows that we treat patients differently here. Why do we treat patients differently here? Because we believe patients deserve it. And just because a mammogram is negative doesn't mean there's no cancer. If the patient feels something, that's enough. So this patient needs a biopsy of the prostate, and then call me back or send her back or both so we can make her understand what exactly this means. My name is Dr. Lederman. If you have questions, you can call our office at 212-CHOICES, 212-46-47, 212-246-4237. Lots of information. People come to us to get that information and give it to their family and friends. I'm talking about a 55-year-old man born in New York City. He's married with 3 children. He's a black man. Why do I say that? Well, black men have a 1 in 6 chance of having prostate cancer. It's a very high number. 1 in 6 black men will have prostate cancer. 1 in 23 will die of prostate cancer. Why am I talking about what we're talking about? So that we can warn you and warn every man of every color and every woman that you can get cancer, things you can do to help prevent cancer, whether it's colonoscopies or pap smears or PSAs or mammograms or screening chest CT smokers. There's lots of reasons why. Now, this 55-year-old man, 14 years ago, he was told he had cancer. 14 years before, he was 14 years old, his PSA was 5, and the doctors told him he needed treatment. So what do you think about that? A 41-year-old person told he don't need any treatment, and so he didn't do anything for 14 years. Now he comes back with a PSA of 39. It's almost 10 times the upper limit of normal, and his Gleason score is 9. Very high. Gleason score is microscope. The highest is 10. He's got 9. So he's very high risk. Very high risk. He has decreased urinary flow. We spoke to him about getting his urinary flow better. I examined his prostate. Rock hard, like a piece of concrete. His pelvis markedly hard. So he has a high stage, he has a high Gleason score, he has a high PSA, and he wants to be treated, and that's exactly what we do. Sometimes people say, oh, Dr. Lederman, how long is the line to get treated? No, we don't believe in lines. We believe that everyone should get treated immediately. I would rather work to make sure you get great treatment in a timely fashion. This is what we do every day here at 1384 Broadway. And we're talking about a woman who's 68 years old. She's married, came with her husband. She has a family history. It's very strong. This woman, she's 68. Her maternal grandmother had breast cancer. Her mother had breast cancer. Her maternal aunt had breast cancer. And her sister had breast cancer. Guess what she has? Well, if you said breast cancer, you're pretty smart. So almost 9 months ago, she fell off the left breast in the upper inner quadrant. It was about the size of a golf ball. She never had a mammogram. Can you listen to that? She has 4 family members, including her mother and her sister, breast cancer. She never got a mammogram herself. It's a big warning sign, so you should think about that. And well, she went to a doctor with a massive doctor, a mammogram, ultrasound, a biopsy. Even the lymph nodes were positive. And she got no treatment. She went and thought about chemotherapy. She did chemotherapy, but small. But there's some benefit to chemotherapy. It's just not overwhelming. She thought, well, if you take chemotherapy, you're guaranteed to be cured. No. And she didn't the benefit of taking 3%. People take chemo 3%, better chance than not. Obviously, taking our treatment, radiation, radiosurgery to the breast is markedly better. Markedly safer. The breast. Remember, the cancer started in the inner part of the breast. And with all the lymph nodes, there's cancer cells that are already traveling from the inner part of the breast across the breast into the lymph nodes. And we got to stop. Make sure the cancer cells travel more. It's been 8 months. I sat there this week, her and her husband said, oh, she's so busy, she's moving as fast as she can. I said, well, 8 months times 30 is 240 days. You see 3 doctors a day, 24 days, and she's had no treatment. And we know that people with lymph node positive breast cancer have high rates of recurrence. We stage drop, we've got a PET CT body. Luckily, there's nothing visible, which is a good sign. It's not a perfect sign, but it's nothing visible. And I believe she needs treatment. She needs treatment to try to stop the cancer before cancer stops her. And in the same day, a patient just like her who refused focused radiation, the cancer grew. Now it's growing through the breast. It's eating through the breast like hamburger. The breast is eaten away by the cancer. The cancer is growing through the skin, the big mass outside the breast and skin. Cancer elsewhere in your body, stage 4 cancer. So if you have a cancer, you want to think about coming for a second opinion. Call us 212 choices, 212-246-4237, 212-246-4237 to get a booklet, to get a DVD, or make an appointment if you have cancer or suspected cancer. So you're not like this one, there's a chance to have the best chance to be cured. If you don't have a treatment, you're really not likely to be cured. You're not having a treatment. This woman had breast cancer in the breast with lymph node involvement. She refused systemic therapy. She's taken 8 months to make up her mind. The best is timely, good treatment, and that's what we deliver at 1384 Broadway. Our treatment radiation is all visible beams to attack the area of the cancer, to minimize harm. It's totally unlike chemotherapy, which has chemicals usually that go through the body. It's totally unlike surgery or something. This is invisible beams with high success rates, whether we treat brain cancers or throat cancers, kidney cancers, prostate, bladder, you name it. This is the work we do, the work we pioneered. And we have lots of information to send you at 2 Choices. Just call our office at 212-246-4237. Go online at listenersavelives.com because we believe you can save lives. Listenersavelives.com. If you want to communicate with me directly and personally, my email is Gil, G-I-L, at rsny.org. Gil, G-I-L, at rsny.org. Stay tuned, learn, be smart. This is Dr. Lederman. God bless you.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal too. First in America, first in New York, first for you with body radiosurgery. Your cancer with no decades of experience with primary and metastatic large organ cancers from head to toe. Cancer treatment, a second chance for you, even if chemoradiation didn't work or isn't tolerated. Goals are your best results and quality of life. Meet Dr. Lederman to hit the cancer. He's New York's only Harvard-trained, triple board-certified radiation oncologist. Call 212 to meet Dr. Lederman for a second opinion. Most insurances, Medicare, Medicaid accepted. Free booklet DVD, too. Super Broadway and 38th in Manhattan. Meet Dr. Lederman. Call 212-212-CHOICES.
Hats off to President Carter. Cancer-free after radiosurgery. Why would a president choose radiosurgery? For the same reasons as you. non-invasive, outpatient, highly successful that hits the cancer. When every hospital, every facility, every doctor thought standard radiation was okay, Dr. Lederman had a better idea. Dr. Lederman, first with body surgery in America. Dr. Lederman hit cancer with no cutting, no bleeding. That's radiosurgery. We hit the cancer, body or prostate, longest in America performing radiosurgery. That's President Carter. You too can have presidential cancer treatment at Radiosurgery New York, 1384 Broadway at 38th. Accepting most insurances, Medicare, Medicaid. For a free booklet DVD, call us, 212-CHOICES. Presidential cancer treatment for you.
My name is Dr. Lederman. People on the real lights always know what to do. And welcome to introduce yourself about your cancer issues if you wish. My name is Dr. Gil Lederman. I'm born and raised in the United States, in Iowa, where my family lived for 100 years, still live there. Went to school there, went to university, went to medical school, graduated, have an MD, medical doctor, doctor, like most people think about doctors as physicians, doctors who are physicians to heal other people. There's all kinds of doctors out there. Some doctors work in a hospital as an administrator, and he's always feeling a little bit, I don't know what, incompetent or something. So he went on one of those matchbooks and became a doctor of a matchbook. And he sent in some money to, I don't know what, Pacific Highway University, and sent the money, got a doctorate on the wall, and afterwards he called himself Dr. X. Well, he was Dr. X after he sent the money. And some of the real doctors, many decades, not years, decades, early in the morning and working and studying, and this week, and how I used to read the encyclopedia. Remembered when I finished reading the encyclopedia when I was 12 years old. That was part of education. I went to university and medical school and MD, and trained in internal medicine for 3 years. University of Chicago, medical reason, board certified, and then at Harvard Medical School, and studied and trained in medical oncology for 3 years, and then board certified, and then 3 more years in radiation oncology, Harvard Medical School, and board certified. So board certified, most doctors, if they're board certified or board certified in one area, what I do about to be able to provide more information and experience to my patients. It was an issue of providing more to each patient. I think each patient probably feels that there's a difference when they come here for cancer issues, whether it's breast or frequentation or high PSA, or in the lung, pancreas, liver, prostate, bladder, or primary cancer. There's a lot of value for the buck, a lot of bang for your buck. Here at 1384 Broadway, where we treat patients with suspected and with cancer, even our chemotherapy, radiation, workers, I tell you, there's lots of people get chemotherapy who just really don't want it, and maybe their family or they feel compelled, or there's a doctor walking your hospital and says, well, off your breast, your arm, or your leg, or your prostate, or your bladder, or your pancreas, or your lung, or your neck. They don't want it, but they go to the hospital and they can't say no. Well, the fact is, if you say, I want to think about it, get out of here and see Dr. Lederman, and I'll get back to you. You can do that until you sign on the dotted line. Yeah, open up your head, or your lung, or your arm, your leg, or your breast, or whatever, until you sign on the dotted line. So you do have choices. And why do I say that? Well, most people need to understand that in medicine there's differences of opinion, and say maybe some surgeons want to do surgery on you, maybe chemo doctors want to do chemo on you, and they're not telling you all the information. I tell you, I see thousands of patients, and most commonly many doctors do not tell patients all the options. Why? Well, it's self-serving. The doctor, there's other reasons they believe. But here at Radiosurgery, we're covered on a different wavelength, on the wavelength that we're here to serve the patient. That's why I went to medical school, to make people better. Not to sell them radiation or surgery or anything, but to inform, educate, understand the patients come here, understand better what has happened to them. So many people come and they just spin over. They've got chemo surgery or seen 10 doctors. Some doctors don't know who they are. Well, here, I treat patients, I'll see doctors. They don't have their business card. They don't even know their name or their email or their phone. Which doctor cut off your breast? They don't even know. There's 100 business cards. You can take 20 business cards if you want, so you can always remember. And also, you can pass on to your friends, because we know that patients and listeners learn things and they can teach things. That's why we're here on the radio. We're here on the radio for one reason, and that is to educate. So I'm now board certified, triple board certified, Harvard trained cancer doctor, working at 1384 Broadway, Broadway 3. You're welcome to call our office. Day or night, get information about our work. Call our office, 2 choices, and it's a simple number to remember. 212 means we're in New York City, and choices means we truly believe you have choices. You're not stuck with surgery or radiation or chemo. You're not stuck with anything. You have choices. The phone number is 212-CHOICES. Speaking of that, I sometimes talk about a doctor from Atlanta, and he had a big mass in his neck. It was the size of a fist. He had seen me. He was one of the super big hospitals in New York City, and he decided to have surgery. He was decided he's going to have his neck opened up, and they're going to do radical neck dissection up in his neck. And often it's a professor that's a radical neck. People like ET. Remember how ET looked on the neck and the big head? Well, that's kind of what radical neck does, because it cuts out a lot of the tissues of the neck. Well, he decided to have a radical neck dissection for his cancer, and he was on the gurney, going in the hospital naked, of course, naked in a hospital gown and a sheet. And he was wheeled down the hallway in the elevators into the operating room, and he saw what was going on, and all of a sudden, he decided to come back to me. He got off that gurney. He was naked, wrapped around a sheet. He got out of the gurney, ran out of the hospital, got a taxi, took a taxi to see me, and he said, Dr. I would have that surgery today, but I've decided to go with you. I want radio surgery. And so had radio surgery. His pictures in our booklet. You can come and see the hallway of our museum in our office, or you can call our office to get a booklet, and you'll see his neck before and after surgery, and had this beautiful illusion of this huge mass of the neck, no anesthesia. It's just because you decide to surgery, you can't change your mind. Until the event happens, you can always change your mind. And this man changed his mind. He was so happy, he lived, and cancer-free, and all the things men want to do. He was work and make love and travel and enjoy and ate. And he did so after our non-invasive treatment made him cancer-free. Well, we had a man who heard the story, and his name. He's 22 years old. He's married. He's married to a fellow New York City police woman. He has 2 stepdaughters with his wife, and she's a sergeant in the New York City Police. And he had kidney cancer. He went to one of the big hospitals in New York a year and a half ago when he had blood in the urine. It's October, a year and a half ago, he had the urine. He went to this big hospital. I should say that he never smoked. He was one of the biggest causes of kidney cancer. He never smoked. His father was a smoker. And so he got secondhand smoke from his father. And this is another educational point. You're 40 years old and you stop smoking today, you live 9 more years. So there's a lot of stop smoking. If God forbid your parents, your father smoking, try to get your parents' family to stop smoking. Why should they hurt themselves? Why should they hurt their family? Well, that was his only smoking experience, and he had blood in the urine. We often talk about that as an educational point. He had blood in the urine in the hospital, and talk about this. Also, what about the problem? And also, a surgeon pops out and says, "You got surgery, you got surgery." Well, this big hospital, and 2 popped out, a big surgeon, a white coat, and a stethoscope around his neck. And this man said, "Yes." Now, what's interesting about that, one, is that we know that kidney cancer doesn't mean you have to lose a kidney. We treat people with kidney cancer every day with high success rates without removing that kidney. But that surgeon in a big, super famous hospital did not tell the patient that he could save his kidney. No, he only told him to lose the kidney. Why would the surgeon tell the patient the only one option is to lose the kidney? Well, maybe the surgeon gets to the hospital, but I think the patient should have been told that there were options. And he was never given an option, which I think is very unfair for the patient. And the patient came back, and he was found to have cancer across the lung. I don't think they really staged the person. They didn't do the testing before they got his kidney. They just got his kidney. Lots of luck. And then he came back, he had a chest x-ray, the cancer traveled to the lungs, he had a CT scan, all the money was lung, and he was to the chemo doctors, and he was worked up. He was losing weight, he lost 27 pounds. Why? Well, because the cancer was eating at his body. And then he came, and he tried systemic therapy, and he decided he just did not want systemic therapy. And I saw him with cancer, stage 4. It's a 52-year-old policeman. Wonderful man, great man, intelligent man, serves the community. Now has stage 4 cancer at age 52. For nothing that he's done, he has done nothing to deserve this cancer. And he came to me, and he chose to have radio surgery to these lung nodules. He should not have chemotherapy. He can slowly, if all, shrink the cancer comes back to chemotherapy temporarily. He didn't want that. He did not want the side effects of chemotherapy, not chemicals in his body, poison in his body, immunotherapy in his body with low success, with effects on his entire body. Possibly. He didn't want that. He wanted pinpoint radio surgery. Pinpoint. And that's what we do for kidney cancer, primary kidney cancer, or metastatic kidney cancer. We recently had the world's largest radiology meeting presented by Dr. Lederman, showing a 97% success rate for metastatic kidney cancer to the lungs, treated radio surgery by us and our team, our experienced teams, the work that we do. We're able to treat primary cancer and metastatic cancers most anywhere in the body. Well, many people say kidney cancer respond to radiation. Well, we're not using radiation, weeks of treatment. No, we do pinpoint treatment. We make a whole body, computerize the body, we find the cancer, thousands of angles, we attack the cancer. And that's what we did for this man last year. And then one day his wife called me up and she says, "My husband is dizzy, he's falling down. He's not himself." And I said, "Okay, go immediately to come here or go immediately to the emergency room and have an MRI. Probably has brain metastasis, because of cancer in the system. He can travel anywhere. So we staged him up, found a mass in the kidney, but it was at the other hospital. He walked in the emergency room and guess what happened at the same hospital? Surgeon says, Mr. Policeman, you have to have your head open up. You have to have that cancer cut out from your brain or you're going to die." And the patient remembered the other patient, the man on the gurney, dropped the gurney, wrapped himself in a sheet, and came to me not wanting to have radical surgery. And this patient, 60 years married to 2 daughters, did not want anyone opening his head. He came in to see me immediately. I saw him at the other facility. There's medicines to reduce the pressure on the brain called Decadron or steroids, and they do such a low dose. A dose I've never seen before. I almost wanted to not take out medicine, pushed out surgery. I saw the man. I got him a higher dose, and while I was seeing him, within the hour from that dose, he already got better. And then we got all the options, examined him, right, examined the body, examined him, with his wife. And we spoke about all the options. And yes, he could have surgery if he wants. That's if he wants. But he could also avoid surgery if he wants and have only beam radiation on a table. You just lay down on a table. There's no phobia, no cutting, bleeding, anesthesia. He just comes thousands of angles to attack the cancer. That's the work we do. And he said, Dr. Lederman, that's what I want you to do. You did it once. I want you to I want you to do. And we treated him. Just a few treatments, and the treatments can go up his head, which could lead to stroke or death. Thus, he had a few 10-minute treatments. He laid down, he was on thousands of angles, attack the cancer brain. This is where the first pioneer, Dr. Lederman, first New York brain radiosurgery. Every hospital, every facility, and every doctor in New York thought standard treatment was okay. One doctor brought stereotactic brain radiosurgery to you and your neighbors and your loved ones and your friends and the person down the street, the policeman. And we have the longest experience, the most experience. We're first in New York with brain radiosurgery. No cutting, no anesthesia. You can understand the appeal. Second treatment, you got him across the street to Macy's or Brian Parker, went home or went to lunch. He was able to be fully intact every day, doing what he wanted, avoiding radical surgery. And this was all done, I should say, last year. He came to me just yesterday, and I saw him just yesterday and reviewed his new scans. He had new scans body. And all his cancer, brain, cancer body, all his cancer, stage 4, after only radiosurgery, no chemo, no therapy, no cutting, no bleeding, only radiosurgery, is in remission. I can tell you that he's so happy, and his wife is so happy, and he's fully intact. They're not doing what he wants. He's so happy. And I am too. The sweetest moment of each day is to have success for our patients. And luckily, with our innovative treatment, our patients have lots of success. And we got for every moment of their success. This man who is now in remission, avoiding chemotherapy, avoiding therapy, avoiding surgery in his lungs, avoiding brain surgery, avoiding hospitals. This is how he's doing fully intact with stage 4 cancer. So the doctor tells you after, or she tells you after chemo for the rest of your life, or surgery on your head or your chest. Well, you always fucking call us at 212 Choice to get information in the book. We no charge. You come to our office and pick up the book. Extra because our friends, because we know listeners save lives. I know that for a fact because I see patients on the channel. And he was told to come here by listener like you. So real listeners save lives. Our website is listenersavelives.com. Listenersavelives.com. If you want, if you have a cancer, suspected cancer, you just don't like where you're going, you're welcome to call 212 Choices. 212-246-4277. Patients around the world. We're here to get better care and to get non-invasive care to understand more about disease and learn about all the options. My heart trained cancer doctor here for you, 38 for probably. I was about 77 4 years ago, I was diagnosed with prostate cancer, went to one of the big hospitals. They gave him some treatments, and then he had a family emergency, and he never got the treatments. He had half the treatments. Well, having half the treatments in my territory just doesn't do the job. So this man never showed up. The hospital never called, never arranged. He never saw anybody. He never made understand that half the treatment did not lead to successful outcome. Well, some of the neurologists in New York City just said, well, he's had some radiation, but this doesn't seem like it's working. And the PSA, the blood test, PSA specific antigen, which is the best way to measure success for prostate cancer, no matter what treatment, that should go down to zero. Well, this man's PSA was not going down to zero. It was rising after treatment. He was one neurologist, another urologist, and he was in the hospital, and no one recognized the fact that he never completed the treatment until he came here. When he came here, I got all his records, and I told him, well, you never finished treatment, they were complete. But the hospital were never complete. And of course, it's better to receive all the treatment once series. We are offering treatment to try to resolve his cancer before it gets out of control. We staged his body to make sure the cancer hasn't traveled into neural. In 40 years, we detect the cancer still localized and bring him treatment to try to contain his cancer. This is the work that we do every day for newly diagnosed cancer, for recurrent cancer, or for this man who is inadequately treated. This is the work we do at Broadway, about 30 years in the heart of New York City. She is 77 years old, born in New York City, and she has 2 skin cancers. And I saw her this week. She's 77, she's working for me. I see basal cancer tip of her nose, another basal cancer in her right cheek. She had a history of a left lip skin cancer treated a year ago with surgery, and she does not want any more surgery. She has 2 skin cancers on the tip of the nose and right cheek, and she wants non-invasive treatment. We see so many people with skin cancer, basal cell, and squamous cell cancers. Most anywhere in the body. Of course, the face has amazing cancer because the face gets lots of sun exposure, and most people believe that the sun is responsible. But often people with skin cancers on the hand, feet, and arms, trunk, back, chest, and the rest of the areas of the body. And us, we're able to treat it with high success. Not invasively, so not the kind of most surgery, which is a slicing of the cancer of your body. Our patients like to keep their body intact and use that to still cancer, but leave the body intact. That's what we do, and we've treated so many patients. You can get our book. Our book has cancer on the eye, nose, ear, mouth, other parts of the body too. The whole team, the beauty is non-invasive, easy to come in, treatment, around, go home, but work, cutting passion, flaps or grafts, or transfers of blood or knives. Our work is non-invasive. That's why someone wants to treat both her nose cancer and her cheek skin cancer as soon as possible. And we see many people like that. We're saying non-invasive cancer treatment. I saw 4 years ago. He's 58 years old. He's black. I said, Jamaica, in the black community, 1 in 6 black men will get breast cancer, and 1 in 23 black men will die cancer. The government of Jamaica met with us about the epidemic there, and we have to help. Of course, we say yes, and that's part of what we're talking about right now is to indicate to every person, black, white, and every other race, that they can get cancer. And certain groups have high rates of cancer. This man is 58-year-old from Jamaica. He's married with 3 children. He has prostate cancer. He was diagnosed with PSA 7. He's 6 cancer. He got a biopsy when the PSA went up, and he was treated with us. You know, his PSA is 0. Like, he's happy. Why is he happy? Number 1 is remission. Number 2 is sex life works. Number 3 is zero life works. He knows it with surgery, open right surgery, the success is less, and the complication rates are astronomical. Tremendous damage to sex life, urinary life, with open right surgery. So, he came for a short course of treatment, more effective treatment, and a better quality of life. And we have a book DVD. Copy sent to you. Call office at 212 Choices, 212-246-4237. 212-246-4237, and that's a book with DVD appointment. And if you're very shy, you can send an email directly. You send an email at Gil, G-I-L, Gil at rsny.org, Gil at rsny.org, and I'll answer your questions. It's always best to come in person. This is the work we do for recurrent cancers. You can also call our office with the DVD. I came from Florida. He was in a mass in the area, and I sat down and spoke with him. I said, so tell me about the mass. I have a third testicle. And they said, well, that's not really likely. No treatment. No biopsy. They've grown for a year and a half. It's causing pain, causing him bleeding. He came from Florida here for evaluation because he wanted to find out why he was having pain, why he was having bleeding, why he was having a mass. And didn't know exactly where his mass was. Well, I examined him. And it was a mass 5 centimeters, just about 2 inches, so a hard, funny mass next to his scrotum, and was never evaluated before he came here. He came over 1,500 miles. First, we worked out about this mass. We mentioned that. And it turned out to be basal cancer, like the size of a golf ball, next to his scrotum. And we staged him up to make sure the cancer hasn't traveled as a large cancer. Travel and spread harm. And monitoring him, staged him up. No cancer. It's seen by others. I like to give patients all the options. I said, Dr. Lederman, I want your treatment. This whole beams of radiosurgery to attack this cancer. And we got options, and indeed, we did follow his command and treated him. Remember, this is all 2 years ago. We did 2 years at the beginning. We did 2 years ago. And while we were treating his big mass, completely away. He completely melted away, large mass size of golf arms next to his scrotum, testicles, penis. So obviously, there's only coming to his and that's the surgery. We're focusing on this mass. And anyway, and he came this week for a checkup. I see things I'm talking about. I've seen in the last few days. I come here, talk to you. And about one, he had a big mass. Two, he chose to focus on only. He declined chemo, he declined surgery, declined all the other treatments. Only with invisible beams, and now he's cancer free, figures out, and restaged his whole body, and there's no evidence of cancer anywhere in his body. This is what we do here at 1384 Broadway 3rd Street. Her mother was 57, she's divorced, she has one child, she came with her sister, and years ago she had a cancer of the breast, and she had 10,000 lymph nodes. She went to the super biggest hospitals. And we talk about this. I often talk about this, that at the big hospitals, there's such a push for radical surgery and big surgery. 97% of women at the big hospitals were having mastectomy for breast cancer, whereas in my practice, 90% of women were keeping their breast. I believe everyone should be given all the options. She wasn't really given options. Surgeon told her she had to have surgery. Even though she had 10 positive lymph nodes, she had surgery, and she had that surgery. And then they operated on the other breast, trying to make the other breast look like reconstructed breast. On the other breast like a breast, because a reconstructed breast looks like skin over a beach ball. The right breast that we get doesn't look like a normal breast either. And then the cancer started traveling, and she started to have chemotherapy. Well, at this super big place, they get years of therapy and chemotherapy caused her kidneys to shut down. So here she is, 7-year-old beautiful woman. Both breasts have been operated on. One breast moved. She had a mastectomy, and I believe she did not need that. But they choose it for women. That's a woman's choice. Of course, everybody's right to choose what they want. Some people are not given all their choices. And well, why did you come to me? She came to me because her sister worked for a doctor who knows my work, and the sister is telling the doctor that chemotherapy gave it one of these super big sales for places so famous, caused her kidney failure. She had dialysis 3 times a week for hours, most likely. Now she started on oral chemo because this other chemo causes kidney failure and wasn't working, and the cancer growing. And she has the cancer showed the cancer is traveling, and she has pain from the cancer. She has pain and traveling. The cancer treatment caused kidney failure, and the cancer treatment is not working. Finally, years later, after this long ordeal, she comes here for treatment for advice to take better out of pain. And of course, I would have wished that she came 10 years earlier, so we could put that unnecessary one surgery and 2 surgeries, multiple surgeries, breast, which work, and the cancer travel caused so much disruption to her body. We did our 600 breast cancer, where we tap breast cancer, 90% of the time, sure, breast cancer is very high, and elsewhere. And some with breast cancer, primary breast cancer, or cancer, even prior surgery or radiation, she's small, has failed, and this failed so painfully. Welcome to the man from Guyana. He was with grandson. He had a large prostate, so he had cervical cancer, offered surgery or radiation. He chose surgery. Okay, other sad surgical prostate stories. That surgery was had no more erections. That surgery was done 6 years ago. He's been constantly urine for 6 years. And now PSA stop. So the surgery in New York City at one of the big places didn't work. In fact, it was a drop. Came back. Left in the continent, and now it's here with me to try to get better with the rising PSA. I know the treatment work there. Well, the PSA is going up. Or any other treatment is diabetes and blood pressure. This radical surgery in the big places in New York. So we're staging him up to make sure there's no other cancer. Unlike surgeons rushing to that surgery, we're going to check him out, make sure the cancer is elsewhere, and talk about all the options available to him for recurrent prostate cancer after surgery. And if, God forbid, surgery for prostate cancer hasn't worked, there is a method to give you a second chance to be cancer-free. And many men come with prostate cancer, suspected cancer. So information send. We have DVD. We have a new 2-part DVD sent to you. It's called 2 Choices. Or come to our office. It's available at no charge to you. A man who came from North Carolina, 70 years old. He has prostate cancer, diagnosed years ago. Again, he had radical surgery. After radical surgery, his work, he was 555. He was left incontinent, bone metastasis. He's getting transfusion. He has cancer bones, blood counts, he has severe pain. Now he comes with severe shoulder pain. That's all the options. And it's another reason why so many people come here just to get better on pain. If you have cancer and pain, it'd be best to be seen in person. Just give us a call for consultation. I think about a sad story. So one came 20 years old with her mother and her friend. She's 20 years old. She was an understudent. And she came, and a year ago, she had decreased hearing. She was found with a scan of her head to have an acoustic neuroma. Now, her surgeon told her that she should need surgery. Her surgeon never told her about all the options, but non-invasive options. Her surgeon never told her that Dr. Lederman has large experience in acoustic neuromas with fractionated, non-invasive radio surgery worldwide. And with us, most likely people have high quality of life success. No, she was never told any of this. She had surgery for non-tumor ear, had acoustic neuromas to the hearing, brain stem, the ear, and the transmittance nerve impulse for hearing, as I'm hearing you right now, or for balance. Well, she had a tumor on that nerve, and the surgeon operated on her, never telling her the options. She's a 20-year-old student, and she went through that surgery, and she was left deaf. She was left blind to that eye. She had a facial paralysis. She was able to move her face if she drinks super drink. The food just falls over her mouth. She can't close her mouth. She can't breathe on her own. She has a tracheotomy tube in her neck. Hold it, goes right to the airway. And she can't eat. She has a feeding tube or a peg. And she can't walk. All from surgery on her brain, which could have had non-invasive treatment and most likely continued her normal life with a high degree of quality, keeping her hearing and keeping her vision and keeping her faith and not needing a fake and not needing a pack for food and to keep walking. And had insult injury, literally, the tumor is still there. The surgeon cut under and damaged all those nerves on her brain stem, all those nerves. She's left blind, deaf, unable to breathe, eat, or walk. And now the tumor's back. And by the way, this is what we do, and that's what we say so forth. We get a fresh second opinion. No matter what Hashtag West had a few treatments laid on paper without the tumor. They based on lost experience in the world of fracture surgery, treating acoustic brain surgery. Well, not just people know better. Those people who fought to give only surgery standard treatment, not you not offer you your loved ones, non-invasive treatment. So sad. They use bad words rather than treatment. They bad words, refuse treatment. Years later, their loved ones, and who's first at the brain radiosurgery from the most experienced doctor in New York? Guess what? The whole package of brain tumors, you're welcome to the package. You're welcome to a brain tumor, whether it's a cancer brain tumor, like metastasis, cancer, the brain, and quarter is happening every year. It's called non-invasive treatment of the brain, around the ear, eyes, nose, sinuses, throat, and neck, in fact, the entire body. This is the pioneering work we've done. We've done it exactly for women like this 20-year-old who is going to most likely suffer for the rest of her life because of surgery that left her deaf, blind, unable to eat, breathe on her own, or walk. So there's lots of reasons to bring brain and body surgery to you. You have the most experience, you are the first experience in the hemisphere with body surgery, all non-invasive treatment. My name is Dr. Lederman. For many people with new cancers, suspected cancers, also benign brain tumors, like two acoustic neurons, and illness. So if you want experience cancer, give us a call to two choices, 226-4237. You can turn this into a medical issue related to cancer or suspected cancer. It's best to visit. You can call us to two choices. We accept most insurances. If you wish to send an email to me personally, gil@rsi.org, gil@rsi.org. Call to two choices.
Radio surgery shows Dr. Lederman, MD, York's only Harvard-trained board certified radiation oncologist, bringing the latest and great news, including cancer, and of course, answering your questions on Bob Stone, broadcasting in New York City. And now, please welcome Dr. Lederman.
Thanks, Rob. We're on the radio educating about cancer treatment. We're about cancer, doctor or medical student or resident, or a lot of radiation doctors too. I know they throw competition, but they want to tune in to hear from the guru. And that's my patients, they want to hear themselves. And a lot of people listen because they want to hear about the psychology and the medicine and science. What doctors recommend and talk to patients, how they talk to patients, and what motivates doctors in the hospitals. And why, for example, breast cancer would have a 97% chance of losing her breast at big hospitals, but if that same woman comes to me, she has a 9% chance of keeping her breast. Well, why is that? These are the things we talk about every day on the radio. We are here every day on the radio. And I'm Dr. Lederman, a certified radiation doctor. I'm practicing in New York. I'm not supposed to regular doctor, ex-doctor, I don't know who the heck they are. I'm going to tell you who the heck I am. I'm a doctor for more than 3 years, licensed MD at the University of Iowa, America. Born and raised in Iowa University, graduated in medical school, then trained in internal medicine, which is the science of the practice of internal organs, heart, lungs, and kidneys, and stomach. Trained and board certified in internal medicine, and trained and board certified in medical oncology, which is to Harvard Medical School, and trained and board certified in radiation oncology board number 9 years after medical school. I know some doctors are not board certified in anything, so away from them. Some doctors are board certified in one thing, but not too many doctors. Triple board certified radiation oncologist. I'm the only one in New York, one of the few in the world. What's the benefit to a patient if you or loved ones if you ever sometimes speak? Well, the benefit is you have a doctor with lots of experience. 30 years of practice in oncology here. We're in oncology for almost 40 years. And you got a lot of experience in the room. Experience with thousands of cases, thousands of families, thousands of treatments, experience all in one brain. And you have that, especially for patients, people, cancer, or suspected cancer. Even if treatment, radiation surgery doesn't work as wanted. There's some people out there getting surgery they don't really want. There's some people who get arm removed, leg removed, something's happening every day. I see it every day. Man, right now, he had cancer, called his pelvis doctors, told him they cut off his pelvis and his leg. And he refused. You're not supposed to like you. And they don't some people bold, they have lose their breast and come here for Broadway for different options, different choices. Some men prostate cancer have radical surgery or results are inferior. And the complication rates are off the wall. It's another reason why so many people come here to 1384 Broadway. In New York City, by 30th Street and Broadway, we're close to almost all subways, trains, buses. You come across the country and end up in your office. It's so convenient. So we have at 1384 Broadway. The Broadway 30th Street, between Macy's and Times Square. So we do every week. Every week I see patients every day. I take notes, and then I come here to the radio studio and talk to you about what's going on. So you get to learn, just like a doctor and medical research. I saw on TV. Gilder, this is the work we do. We protect the patient's lives. We learn almost all the details. So from them, what they did after me. And it's quite interesting. Listeners do save lives. You can save lives. You can save lives listening. You end up saving your own life. That many people come to. I've listened to the show every week for years. I know that I would need it for myself. You know, the information you gave me has helped me so much. But let's talk about the man this week. He is 60-year-old man. He's Yonkers. He's married for him with his wife. Contractor. He has blood pressure, heart disease, heart sensitive, 60 years old, lots of problems, heart sensitive, blood pressure. He's seen doctors, right? He's been going to the biggest hospitals, seeing doctors. Well, doctors never told him that his PSA was. Remember the normal PSA? Blood test check prostate normal 4 or less. His doctors never told him that his PSA was 2,800. Yeah, you heard right. Even though you go into the biggest hospitals, the biggest doctors for his heart, for cardiac scans, for medical care, no one ever told him his PSA was off the wall. He was 2,800 biopsy, for adenocarcinoma, and he's a contractor. He's a working man, and he was with terrible back pain, and hip pain, neck pain, and rib pain. And, well, he got started on hormone therapy. That's what Lederman was reduce testosterone. If we reduce testosterone, we can temporarily reduce cancer. He got Lederman, his PSA got better, so intractable pain, he had breast cancer, diffuse, cancer of the chest, intestine, and elsewhere. And chemo doctors are only working on chemo, but no talking about it with pain. And he's unprecedented. Most people don't like how they feel on because sometimes people pressed and feel bad. And often causes constipation, so they're giving them hormones and chemo and narcotics, but the pain's still there. And I tell you, when I used to be a chemo doctor, we had patients who get pain, send him to the best radiation doctor we could, know what that is. They don't send him. He's just in pain, terrible pain. He can really move, get up, get from sitting, standing, he's lying down, he's in terrible pain. He's lost a lot of weight for 40 pounds under, probably because of cancer, eating away his body, eating away his flesh. So if it ends, make sure you go, okay. No, here's a man, the cancer ate his body, he lost 43 pounds of flesh as the cancer was growing. And he's on narcotics, 100% for his blood pressure, Lederman. He feels pain, examined him, he's in pain with any movement. And he wants to get better. He wants to get rid of pain. This is the work we do. I talk about frequently that so many cancer patients are in pain. They're just ignoring it. Pain is terrible. There's no reason to ignore the pain of a cancer patient. That's another reason why so many people come here to 34 because we focus on the patient. We determine what's the issue. Speak to the patient, time patient, family. And the pain suffering is the work we do to relieve pain suffering. We can send invisible beings to attack cancer just a few treatments. And most commonly, overwhelmingly, stop the cancer, stop the pain. Which is what most people want, to prevent the cancer and to get out of pain. So this is what we do every day here at 34 Broadway. We do this every day. Patients with primary cancer, primary cycle cancer, metastatic like this cancer to the bone. He got 2,800, even though he's been seen at all the big hospitals. Never got heads up. His PSA was high. No one spoke about it. He fell through the cracks. Now he's in pain. Fall through cracks again. No one taking care of his pain. Best to pass away. He's on hormonal therapy. He's under narcotics. He's still in pain. It's not helping him. It's not helping. We know that hormones only work temporarily. Chemotherapy only works temporarily. We know it. So here we are. Just remember. And just remember, if you know somebody who's suffering pain from cancer, like cancer, pain, weight, or bleeding, those are reasons to call our office, and you call our office today to request a poll or better yet, appointment to accept insurance at your Our office number is 212 choices, 212 choices, which is 212 246 4237, 212 choices, 237 for an independent freestanding cancer center that works for you, not the drug companies, not the president of the hospital, not surgeons. No, we have one boss, and that's you. And that's insurance. Okay, easily do is call our office at 212 choices, 212 246 4237. This is Dr. Lederman. We're back.
Prostate cancer news. New York Times highlight great risks of prostate cancer in black men. 1 in 6 black men will have prostate cancer. 1 in 2 black men will die of prostate cancer. Not breast. I know prostate cancer. I believe in treating successfully more than 10 years ago. Sad to say, my stepdad died of prostate cancer before I met Dr. Lederman, and I was suffering from radical surgery for prostate cancer. Dr. Lederman believes minimal high success rates to avoid radical and robotic surgery and maintain sexual and control. Like me, for prostate cancer screening and people go choices. Frequently, to call Dr. Lederman 212 choices for your appointment. See, great data changed my life. Most insurance, Medicare, Medicaid, except 1384 by 38. Call Dr. Lederman 212 choices.
Many people with cancer come to Dr. Lederman. Surgery didn't help. Toxic chemo stopped working. Men come in pain. Many people with cancer come to Dr. Lederman when their caregiver has no care to offer. Dr. Lederman, pain, cancer care for decades. But the next cancer drug is not as common. The surgery will fail to pass. Meaning it offer you new cancer treatment options. You treat cancers, small or large, most in the body. Even if prior radiation or surgery didn't work. Call Dr. Lederman 212 choices. 212 choices for a free booklet to get 8th and Broadway. Most insurances, Medicare, Medicaid, accepted for training, board certified treatment. 212 choices. 212 choices for cancer treatment. Best is to meet Dr. Lederman in person. Call 212 choices. 212 choices.
Welcome back to Surgery Hour. This is Dr. Lederman at the New York Heart, New York City, Surgery Cancer Center, Broadway, Dr. Lederman, prostate cancer, New York, brain research, and cancer. You can also call Dr. Lederman for free. We're back.
This is doctor, but he's not a doctor. He's a doctor, and he's a doctor who gives concoctions to people with cancer. So he's a patient one, but he's also a doctor doing concoctions, which I don't agree with. Why is that? Well, with cancer, think there's a magic bullet, stop eating sugar, or eat coffee others, or vitamin C. Don't work. Like I've seen thousands of people with concoctions, vitamins, enemas, drips, and it just doesn't work. And the problem is that people have hopes and they believe what they're saying something, and yet they're saying things that are not true. So what happens when the doctor who's encouraging people, honest people with cancer to get concoctions that don't work? What does that doctor himself get cancer? It's a good question, right? You ever wonder about that? All those people who do scams and also get cancer, and they believe their own concoctions, or they go to the doctor. Now, real treatment has the best chance to work. Here's a story about that man. He's 55 years old. He's single, children, and a year ago, he had a large mass in the neck. So he went to the neck, mass plum. The tomatoes was biopsy, he was going to have cancer. He had cancer markers, so his blood tested, going blood, because how much the cancer is. And blood, he had elevated cancer markers, like CA99, which is usually cancer marker for the pancreas, and marker for his head and neck cancer. And had a CEA, which is a general cancer marker, almost like 3. The CEA was 114, so about 35 times normal. And he had cancer, and the check his neck. He had a joke, so cancer of the tongue, the troubles in the neck, and then he started concoctions. Well, he started concoctions. Also, they talk about preps, enemas, vitamins, antioxidants. Remember, he's got sells these things. Or also sells things to people with cancer, like your friends. Now, never smoked, just a throat cancer, never smoked. There's another epidemic, big point in men right now. This epidemic, human papillomavirus with cancer. Remember, like Michael Douglas had cancer of the mouth, and he got up after he was treated, and he said that he thought it was oral sex, and he got it through oral sex. And there's another problem that men, Jimmy Lemon, who's one of the snakes in America, also had a throat cancer. So he got the tip of the iceberg of middle-aged men. I'm sorry, especially throat cancer, mouth cancer, cancer. Now we're seeing a new picture, a new cause. Cause most likely is human papillomavirus. So another teaching is if you have children or grandchildren, there's a vaccine now, and you give your children a vaccine so they don't get less likely to get human papillomavirus. All cancer is associated with human papillomavirus, like cervical cancer, anal cancer, and this difficult cancer, throat cancer. So this man, a mass on the tongue, a mass on the neck. He started concoctions. His weight is 254 pounds, around 290, lost about 50 pounds, more than 50 pounds. The means the cancer needs fuel to grow. And where does it take fuel? It takes it from the person's body. It starts eating up calories, eating up fat, eating up muscle, eating up the fat. This cancer was eating up the fat. Also, because of cancer of the tongue, it was harder to eat than the food around gets the teeth up in the chest. And also, many people with cancer of the tongue have pain in the ear because it's the same nerve to the tongue and the ear. And sometimes he says blood. There's another teaching I often talk about. The blood is a warning sign. So he had all the warning signs. He had his mass, he had weight loss, he's had pain, he's had all the warning signs, and he never got the treatment. Okay, because he has the fist size mass, the fist is a huge mass in the neck. He's not able to move his tongue out of his mouth because the cancer is so massive, just sticking the tongue down, like nailing down the surface inside the huge mouth. He has a little bit of his mouth. He has lymph nodes both the right and left neck. And squamous cancer. Cancer for a month and a half trying to decide what to do. Well, luckily he came here, luckily after a year and a half, fussing around, got a scan, and wanted to get a scan of his body. We got a scan of his body, make sure the cancer traps his body. And we offer all the options you can have. Also, it would be options. Cancer so massive, it'd be kind of basically all mouth, it's not an option really. Surgery is not possible. Chemotherapy myself doesn't cure the throat cancer. The best people approach with focused radiation. This is work we do. We've taken on many tough cases like this, massive cancers in the mouth, throat, neck, and even pictures I give to us from Georgia with massive cancer cases. He's actually stopped in the stretch going to the operating room with the big hospitals in New York City. They're pushing the operating room. Well, the sheet. I've seen him before. Always in that stretcher going to the hospital, always the operating room. He changed his mind. He got off the stretcher. He jumped off the stretcher, wrapped himself in the sheet, took a taxi, came to Dr. Lederman and me for our treatment because he did not want to have radical forming surgery. He had our treatment and went in complete remission. You can see his picture on the wall. You can see his picture in our office. You can learn about him. So many people talk about cancer disease all over the world and try to help everyone that we can. That's why I would like to help people. And this is the work we do. It's not the drug companies, it's not the hospital, it's not the president of the hospital, it's not the surgeons. With the medical school to be able to help you and your loved ones and your friends and your neighbors. And the medical down does people who know the other trouble. And if you're comforting words, it will help them. You might want to tell them to get a second opinion. If you think they're in trouble, if they're not doing well, if they think intent about the treatment. Some of your patients have been referred by you and other listeners, and they're eternally grateful to you, but I can tell you I see their patient and I know. I'm Dr. Lederman, cancer doctor 54 where we treat cancer with prostate, breast, lung, pancreas, lung, primary metastatic. This is the work we do every day. All invasive, how do our work is what we do cancer, thousands of bills, with high success rate, few treatments, highly focused. This is the work we first pioneered in America. This is exactly what we do. We have lots of information to send you or better, come across, and DVDs, and pass on your friends and neighbors because you might be able to help save their life or all life is safe. Rest of the bladder, the prostate, the brain. You have the ability because listeners save lives. Our listeners, SaveLives.com. I'm going to be right back.
Invisible radio surgery being cancers, new concurrent, primary metastatic, small large, and body, entire surgery, chemo, radiation, is tolerated. The first radio surgery to America when every hospital and physician said radiation was okay with first again. Invisible being cancer. Radio surgery is invisible, non-invasive outpatient therapy. It's not hospital with no cutting, no bleeding, no hospital stay, and no anesthesia. We extend experience with both cancers, lung, breast, prostate, and more. Frequently, call 2 choices. Dr. Lederman in person at 38 antibody, also Medicare, Medicaid accepted. Every hospital and physician said radiation was okay with first again. Invisible radio surgery. Call 2 choices. 2 choices.
Prostate cancer news. New York Times highlighted great risk of prostate cancer in black men. 1 in 6 black men will get prostate cancer, and 1 in 20 black men will die of prostate cancer. 240% mortality. Authors pleaded for action. Caribbean Nation asked as our results, how people with high prostate cancer and cancer rates in Caribbean. Dr. Lederman agreed. We learned prostate cancer treatment for decades for all. Prostate cancer will be men with high success rates, so radical black surgery and sexual and urinary control. Prostate cancer screening. Call Dr. Lederman. 2 choices. Free TV2. Dr. Lederman. 2 choices. 2 choices for your appointment. See our results. Insurance and Medicare accepted. 24 hours. Dr. Lederman. 2 choices.
There's lots to learn, and there's hours to learn, and you can learn as much as you want. More learn. Some doctors listen to this program. Many doctors listen to use it as their main source of education. Many doctors use it to understand. Many doctors listen and they come here, fear for themselves. And many doctors are patients here, and they know that independent cancer has lots of advantages. That know the patient knows us, so communication is intimate, and it's close, and it's not adulterated by lines of communication. So lots of advantages. Independent, freestanding, boutique style cancer treatment center at 1384 where we accept most insurance. 19 years old. She's in college, and she's seeing her mother, and she had cancer of the adrenal gland, abdomen above, and one case gland above the kidney. She's 3 years ago, 4 years ago, she lost her mental cycle, and she's a gynecologist, and a psychologist, doctor. So I think women's reproductive organs and endocrinologist, and they work by she lost period and found she had mass in the adrenal gland, and she was super hospitals, and surgeons, you know, they are big white coats, stethoscopes, and macho, as well, they're going to with blood, and you'll be fine. Well, that's what she was told. She told me that, and I believe her. But they never know this big robotic machine. She tried to get out the adrenal, and cancer just exploded in that robotic machine and spread all over her abdomen. Calamity, yes, it's a calamity. Where there's not cancer, to remove the entire cancer, not leaving cancer cells behind. Well, here, no, not explode cancer, spread all over the abdomen. So they did the opposite. Supposedly, it was supposed to not really powerfully, and that's hurt her. Wow. And then after cancer, travel over cancer, 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 well. Sometimes after the tumor. This one, they exploded tumor. 2 months later, cancer in their lungs. And they went out of their lungs. There was an adrenal. And they started therapy. Another therapy working for cancer. They said, why do they do it? Well, lots of reasons they do it. They do it because they can do it. They do it because they get paid for it. Pharmaceutical companies, I have $10,000 in chemotherapy. So if therapy is great for everybody, the recommendation is for the hospital, everybody, but the patient. And cancer just stopped progressing. They chemotherapy for a year. A 19-year-old woman. Beautiful. Really sad story. And then they opened up her belly. Remember, they always said cancer about it. They cut off again. And again, they left cancer behind. They cut right through the cancer. And then they got cancer in the liver. And all these treatments, surgeries, multiple surgeries, chemo. Nothing worked until she learned about us. For a little Q, she's actually seen me now for 2 years. Treating her to stabilize treating cancer with focus, brings her to treatment, to cancer in the chest and the abdomen, when the other treatments just didn't work. So come here, you got chemo surgery. Everything. It doesn't work. Nothing worked. And so she came here to 13 for here, and finally that treatment worked. And why tell you about her? So you can learn and understand. She got to go and get advanced surgery, chemotherapy, all operations at the biggest hospitals in the lung, biggest hospitals in the abdomen. Doesn't work. Another treatment worked until she came here for 34 in New York City. And this is the work we do. And I say, why not about? I tell you, I was the first doctor in America. A lot of abuse, a lot of criticism, because other doctors know it's we have so great. Other treatments have not great. Even today, someone with robotic surgery with our lung and abdomen and chemo, it just hasn't worked. So there's lots of reasons. Every hospital, every doctor, every facility, the standard treatment. Okay, there's one doctor. All those doctors, all those said no. There's a better way to focus and hit the cancer and not hurt healthy structures. And that's what body surgery is all about. Non-invasive treatment, invisible beams, the type of cancer and not hurt healthy structures. Does that sound more showing than having your chest abdomen up or chemo from head to toe for life? That's what we do. So many people come here for cancers of the adrenal, the kidney, the bladder, the prostate, the lung, and the breast. Every other organ, this is the work we do, primary or medicine cancer work. And lots of information we have to send you. If you wish to call office, so if you want to get a book for brain cancer, body cancer, prostate cancers, or if you have cancer, suspected cancer, just make an appointment. Call 212 choices 212-246-4237. Everyone from stage 67, like a woman. She's in marriage with children, living at home, and 3 years ago, the breast was great. And doctors moved along, and they moved and 2 of those cancer. The size of the cancer, 7 years old each order. And she never got a CAT scan, she never got a staging. And she took all kinds of concussions. A number of things, scams, just so many concussions. B17, vitamins, toxic, vitamin C drugs. The cancer's been growing back. It's growing. Discomfort. Just last 10 years ago, cancer growing the muscle below the breast. That's why we have muscle, brows, a man, and often the cancer spreads under the brows muscle. It spreads under the brows muscle to the armpit. Someone lost weight 2, 145, 142. Recurring theme, why is that what cancer is wrong? Needs calories. Can we eat anything that will get rid of keep your body intact? Prevent cancer, cancer. Don't always mission is to grow and take your life. That's all it knows. We have a mission is stop cancer, reverse cancer, get rid of pain, get rid of suffering, all non-invasively. When I saw someone, she had 300 mass in the armpit. Her right armpit. Remember that surgery left side was okay. She had recurrent cancer and spoke about options, and she came here for treatment. Finally, she came here after concussions and scams and nothing worked like other. She was rationale of our treatment. And this is what she's done. She signed up immediately. She came to me. We got measurements. We were able to send visible beams to breast cancer. Oh, no, I don't So let's do, because we have always many patients with cancer who are just not comfortable with the case in their life. They want to simplify it and explain, and that's what we do every day. Give advocacy for our in New York City. And we have a gentleman who's 70 years old, born Florida, he's ready for kids. He's like, why? He has malaria, myeloma. Myeloma is a tumor bloodline. Generally, it causes pain because it draws the bone, it causes terrible pain. His weight is 193 pounds. He undergoes an exam, nothing more about. He got some mass in the abdomen, just to see if I can. We offer treatment. We try to help him. And we can see it. In fact, his case most recently is 0. So another good result here at 34 Broadway. And one more patient began, lots of men, in the area with prostate cancer. Jamaica, more than 1 in 6 men get prostate cancer, more than 1 in 1 people die of prostate cancer. There's lots and lots of cancer, prostate cancer. In Caribbean, 6 years old, his son is PS 6 10. He's recent 6 cancer. And he wants to be cured. This is the work we do every day. Why keep ourselves because your life is sexual life and his quality is so good. I'll be right back.
Do something over him to people cancer in whom standard radiation chemo or surgery just doesn't work. Like surgery. Surgery is highly precise, non-invasive treatment. It works. And radiation chemo surgery doesn't work or isn't tolerated. I'm not going to be crashing like chemotherapy. Surgery is very well tolerated. Yes, there's often non-invasive options like surgery. I believe it's go to an issue about cancer. I know something's gone for my father, family members. So something has not been limit for you. Cancer treatment has 200 choices. First America. Accept no patient. Innovative, non-invasive cancer treatment with no complications. Decades of experience. Brain, body, prostate cancers. Call for choices.
Dr. Lederman, 97% women losing their breasts as breast cancer treatment, but 8% patients with breast cancer keeping their breasts. Dr. Lederman, outspoken advocate of educating women about choices. Telling everyone about breast cancer choices, breast cancer, hospital, and when hospital and radiation is okay. Dr. Lederman had a letter in Dr. Lederman first board, radio surgery in New York, body surgery, Dr. Lederman, breast surgery, Dr. Lederman, decades. 84, call 2 choices, 2 choices about breast cancer treatment. Home insurance, Medicaid, for fresh and Dr. Lederman, breast cancer, call 2 choices, 2 choices, couple of today, 2 choices.
Many people with cancer come to Dr. Lederman when surgery didn't help and toxic chemo stopped working. Many come in pain. Many people with cancer come to Dr. Lederman when the caregiver has no more care to offer. Dr. Lederman, innovative cancer care for decades. But the next cancer drug is not as honest. And surgery was failed past. You need to offer you new cancer treatment options. treat new cancer, small or large, most anywhere in the body, radiation, surgery, call Dr. Lederman. Two choices for people that deviate, two choices. Two choices.
A man who has a high PSA, he said about 20, he said 3 5 doesn't show cancer, estimated in a year and a half. He came in for weird cancer, she worked because about 6% of men with PSA breast cancer, just because of cancer, so this is metabolism before, PSA is rising, so it's highly worse for cancer. And of course, we were to get blood immediately back, we go over the results and talk about all the options of diagnosis and treatment. But we like to get blood, just copies of them so you can exactly see what's going on in your life or your life. And I want to talk about a woman who was 9 years old, she has 4 children as well, and she had ultrasound of her breast, and she was nothing, she saw mammograms, she saw doctors, but she nothing. So it's at her home, but she knows that we treat patients differently here. Why we treat patients differently? Because we patients deserve it. And because mammograms negative, there's no cancer, patient feels something. That's enough. So this patient needs a biopsy on the prostate, and then coming back, or something back, or both, so we can understand what exactly this means. My name is Dr. Lederman. The question more often is choices. Who went to the first 47? Who went to the first 47? Lots of information. People come to us to get that information to their family friends. We're 55 men, we're 60, he's black man. Let's say black men have 1 in 6 chance of having prostate cancer. So very high number. 1 in 6 black men have prostate cancer. 1 in 5 prostate cancer. I found out, so we can warn you. And warn every man, every woman that you get cancer, so you have breast cancer. Colonoscopy, pap smears, PSAs, mammograms, screening tests, smoker. There's lots of reasons why. That's 55 year old man, 40 years ago, he was cancer 40 years before. He was 41 years old, PSA was 5, and the doctor told me they didn't treatment. So when you got that 41-year-old person told you treatment, so he's been anything for 40 years. Now he's got a PSA of 39, so almost 10 times the upper limit. His Gleason score is 9. Very high Gleason score. The highest is 10, he's got 9. So he's very high risk, very high risk. His deep urinary flow, his urinary flow, better examine his prostate, rock hard, because concrete is really hard. Just a high stage, high Gleason score, high PSA, and he wants to be treated, and that's exactly what we do. How long is the line to get treated? No, don't believe it. Everyone should get treated. I've worked more staff more to make sure you get treatment in a timely fashion. So we do every day here at the Chico Broadway. My woman is 68 years old, she's married. Her husband's advantage is very smart. Woman, 68 years old. Her mother has breast cancer, breast cancer, their sister has breast cancer. Guess what she has? She said breast cancer, pretty smart. So almost 9 months ago, she got a lump in the left breast in the upper inner quadrant. She looks like a golf ball. She never had a mammogram. Just that, just 4 family members, including mother and sister, breast cancer. She never got a mammogram herself. It's a big warning sign. She should think about that. And well, she go to a doctor with a mass, doctors and mammogram, ultrasound biopsy. Even the lymph nodes were positive, and yet she got no treatment. She went to the chemotherapy, and she was therapy better. Small. After some chemotherapy, it's not overwhelming. She got chemotherapy, guaranteed the cure. No, she didn't really take chemo, people taking 1 3% better chance. Not obviously taking our treatment, radiation, surgery to the breast, markedly better, markedly safer, the breast area, the cancer in the inner part of the breast, and all the lymph nodes, cancer cells are already traveling from the inner part of the breast across the breast into the lymph nodes. So we got to stay up, make sure the cancer more. That's been 8 months. And I said this week, her husband said, "Oh, she's so busy, she's moving out, she's cancer." 8 months, 30, 40 days. You can see 3 doctors a day, 3 or 4 days, and had plenty of time. And yet she's had no treatment. We know that people with lymph breast cancer have high rates of recurrence. We stage her up. We got to see her body. A lot of things visible, which is a good sign. Very sign visible. And I believe she needs treatment. She needs treatment to stop the cancer before the cancer stops her. And the same thing, I have a patient just like her who refused focused radiation. The cancer grew. That's from the breast, eat the breast, the breast is eaten by the cancer. Cancer grows to the big mass outside the breast and it's spread outside the body too. So just stage 4 cancer. So if you have cancer, you want to think about coming in for a second opinion. Call 2 choices. 212, 246, 4237, 212, 246, 4237. You go to the ER, point to the cancer, cancer. Now, like this woman, you see her chance to have the best chance to be cured. Not treatment. You're really not likely to be cured. Now, treatment, breast cancer, breast with involvement. She refuses chemotherapy. She's taking 8 months of line. The best is timely good treatment. That's the product. Treatment, radiation, all visible being focusing. In fact, the cancer in my arm. It's totally like chemotherapy. Just chemical tissue, the body, totally like surgery, just mechanical removal. This is invisible being high success rate, brain cancer, cancer, kidney cancer, prostate, bladder. You name it, this is the work you pioneered. The lots of patients send you at 212, 246, 4237. You go online at listeners-save-lives.com because we believe you can save lives. Listeners-save-lives.com. You can communicate with me directly, personally, emails, giljail@rsny.org, giljail@rsny.org. Stay tuned, learn, be smart. Stop leaving God bless you.
For cancer, most effective, non-invasive, well-tolerated therapy. First for you, with non-invasive surgery. Cancer, experience, primary illness, large cancer, cancer, possibly second chance to you. Even if chemo beats the work, or both are not quality life, cancer. Is your own heart cancer or radiation cause? Call 212 choices to meet after the first opinion. Most insurance is medical, really easy to super cancer, cancer. Call 212 choices. Doctor Carter, cancer-free after radiation surgery. Why present 2 surgery? The same reason as you. Non-invasive outpatient, highly treatment. It's cancer. Every hospital surgery, radiation is okay. I don't have an idea. First with surgery in America. Radiation cancer with no bleeding. That's surgery. We hit cancer, brain, body, or prostate. Long term America perform body surgery. Doctor Carter, you too have presidential cancer treatment at radiation surgery. 3844 most insurance is Medicare, Medicaid. For free book, DVD cost 2 choices. Presidential cancer treatment. My name is Dr. Lederman. There's a lot of people on the radio life. It's always I know what we do, and let's do stuff and you want to call yourself on cancer issues. My name is Dr. Lederman. I'm born and raised in the States in Iowa, where my family for 400 years over there. I school there, really medical school, graduated MD degree, medical doctors, physicians, doctors, keep other people, doctors, for hospital administration, Australia. A little bit, I don't know what, in common or something, so we put matchbooks, I became a doctor of matchbook, and he sends money to Pacific University, and sends money to his doctorate at Wall, so Dr. X, Dr. X, money, so it was real doctors for many decades, not years, decades, early in the morning working and studying, and I was just speaking how I used to read the encyclopedia, part of education, and I was going to be in medicine for years, at the University of Chicago, medical board certified, and then went to medical school, studied and trained in psychology for years, and board certified, and then on 3 more years, in radiology, medical school, and board certified, triple board certified, most doctors board certified in one area, board certified, why I be able to provide more information and experience to my patients. This is what matters. I felt it was an issue of more to each patient. Each patient probably feels that there's a difference between cancer issue of mass and breast or frequent nation, PSA, or mass and lung, cancer, liver, prostate, bladder, primary cancer, cancer, liver, patients suspected with cancer, chemotherapy, radiation, workers, one tolerant, a lot of people getting chemo surgery who just don't want it, and maybe your family is compelled to stop walking in your hospital room as well, cut off your breast, your arm, your leg, your bladder, your lung, your neck, your head. You really don't want it. If you go to the hospital and cancer, no, well, the fact is, if you say, well, I think about it here, and see, I believe in it, you do that, you just have to you can't your head, your lung, your arm, your leg, your whatever. If you do you have choices about ways, most people need to understand that, because there's difference between some surgeons want to do surgery, chemo on you, and not telling you all the information. I see thousands of patients, and most commonly, many doctors do not tell patients all the options. Why well being self-surgery with doctors is the reason there's a relief. But here, every surgery work out a different wavelength. I'm here to serve patients. So I know medical people better. Not to sell them radiation or surgery, chemo, or anything. It's important to educate, to understand that patients come here. Understand better when this happens. So many people come, it's been blurred. They've got chemo or surgery, seeing doctors don't know how to see. Some don't know who they are. Well, here, you know who I am. Patients don't see doctors. They don't know the business card. They don't know their name or email or phone number. So which doctor, they don't even know. Here, 100 business cards. You can take 20 business cards if you want. You can remember. And also, you not only remember, you pass on to your friends because you know that patients and listeners learn things and they can teach things. And that's why we're here on the radio. We're here for one reason, and that is to educate. So I know, we're certified, cancer doctor with 34 hours, 30 days. We call office day or night and get information about our work. Call office at New Choices. Remember, you went to New York City and choices. You have choices. Stop with surgery, radiation, chemo, anything. You have choices. All numbers, 2 choices. And speaking of that, sometimes I had many years ago, a man doctor met and big mass in his neck the size of a fist. They seen doctors want to super for big cancer hospitals in New York City. And he started surgery. He was putting his neck without the right neck section of his neck. I was performing breast power neck. People cannot ET. Remember, he looked at neck and they had the right neck. Cut out the neck. Well, he's not right neck section for his cancer. And he's under, and he goes down the hall in this hospital, naked, of course, naked in the hospital, in the sheet. And he wheeled down the elevators to the operating room. He saw what was going on. And all of a sudden,
he decided to come back to me. Dr. Lederman, and Dr. Lederman, around the sheet, ran the hospital, got a taxi, to see me. He's Dr. Lederman, I've got a surgery today, but I decided to go with you. I want radio surgery. And this man had radio surgery on the report. You come see the hallway, museum in their office, our office, open the neck, before and after surgery. This beautiful resolution, this huge mess in the neck, with no anesthesia. And I say because you decide one day to serve doesn't mean you change your mind. Tell you about habits, you can always change your mind. This mind change your mind, it makes you happy, live, it's cancer free, and you can all things you want to do is work and love and travel and enjoy and and get yourself after work on and basically make him cancer free. Well, that man who heard the story, and this man's beautiful, about him, telling his name. He's 50 years old, he's married, a fellow New York City police. He has 2 stepdaughters with his wife, and she's a sergeant in New York City police. And he had kidney cancer, so he went to the hospital in New York about a year and a half ago when he had blood in the urine. So October, a year and a half ago, he had blood in the urine, he went to the hospital. He said he never smoked, he causes kidney cancer. Never smoked, his father smoked, and so he got secondhand smoke from his father. It's another education point. You're 40 years old, you stop smoking today, you'll live 9 more years. So it's a lot of dividends stopping smoking. Your parents and his father smoked. Try to get your parents to stop smoking. Watch their stop smoking. Well, this man's only smoking experience, and he had blood in the urine. We'll talk about that education point. He had blood in the urine, he went to the hospital, and it's also when I have problems in the surgeon hospital, you can have surgery, you can't, you got to have surgery. Well, this big hospital, and this big surgeon, white coat, says on his neck, he's got to lose kidney cancer. And this man said, yeah, no, we're about that one. Because we know that kidney cancer doesn't mean you have to lose a kidney. We treat people with kidney cancer every day with high success rates. We know he's not removing that kidney. But that surgeon at a super famous hospital did not tell the patient that he could save his kidney. No, he don't get to lose kidney. Why would the surgeon tell the patient the only one option is to lose kidney? Well, maybe if the surgeon is to the hospital, but I think the patient should have been told there were options. There were options. And he never given an option. He was never fair to the patient. And the patient came back. And he found out he had cancer from his lung. Well, he goes to the person who was testing for it. His kidney was lung. And then he came back to test the cancer from his lung. He scanned multiple levels of lung. And he was neurologist and surgeon kidney chemo doctors. And he was worked out. And he was losing weight. He lost 27 pounds of weight. Most likely because cancer was eating at his body. Then he came and he tried systemic therapy. And he decided he just did not want systemic therapy. And I saw him at that cancer stage 4, 52-year-old New York City policeman. Wonderful man, great man, intelligent man, surgeon community, who has stage 4 cancer, age 52, for nothing that he's done nothing to deserve this cancer. And he came to me, and he chose to have radio surgery to these multiple lung nodules. He did not want systemic therapy, he was chemotherapy. Slowly, if all, showing cancer, back, chemotherapy, early. He didn't want that. He did not want the side effects of chemotherapy, he didn't want chemicals in his body, poisons in his bodies, immunotherapy in his bodies, with low success, with fast on his entire body possibly. He didn't want that. He wanted the point radio surgery. And that's what we do for kidney cancer, primary cancer, metastatic cancer. We usually done the world's largest meeting, because I'm human, 97% success rate for metastatic kidney cancer, the lungs, treated radio surgery by us and our team. Our experience teams is the work that we do, where we treat primary cancer and metastatic cancer anywhere in the body. And while people say cancer is fine radiation, we're not using radiation, radiation, weeks of fields. No, we do treatment, we mold the body, computers, body, find cancer, positive angles, we tap cancer. And that's what we did for this man last year. And then one day his wife called me up and she said, husband is busy, he's falling down, he's on himself. I said, I go immediately come here, go to his nurse, right, who has a brain metastasis, cancer system, he can travel anywhere and travel to his brain, memory, a surgery on his kidneys, the doctor never takes him up. So we take him up, we find a message, can you go to the hospital, he has to have it again, the same hospital. So he comes in and says, Mr. X, you have to have that cancer cut for your brain, we're going to die. And the patient remembered, the other patient, the other patient, she came to me not wanting to have radical surgery, and this patient was 0 to 2 not wanting to open up his head. He came in to see me immediately, I saw him, and so he does through the pressure of the brain, that I got on steroids, and it was such a low dose I've never seen before. I almost wanted him not to take that from medicine, so he was surgery. I saw him, got him dose, and while I was seeing him the hour, for the dose, you get better. And we took all the options, I examined the body, I examined him, I examined his wife, we took all the options, surgery once, he also avoid surgery once, and only focused on radiation, I don't know if it was possible, I believe in he's from positive cancer. That's what we're doing, that's what we do with our lungs, that's what we do with my head, that's what I want you to. And here's the treatments, compared to what happened, either stroke or death. With us, you can do something, attack the cancer brain. This is where the first pioneer doctor me, first brain surgery, every hospital, every facility, every doctor, standard treatment was okay. One doctor brought stereotypic brain surgery to you and your name, blood person, person, street, policeman, and we have the lungs experience, most experience, first brain surgery, local anesthesia, and appeal. This kind of treatment, you got to go across the street, right part, lunch, and it was a peak fully attacked every day, avoiding radical surgery. This is all I say last year. He came to me, she checked, and I saw him just reviewed his scans, body. And all his cancer, brain, cancer, body, all his cancer, stage 4, after only radio surgery, no chemo, no chemotherapy, no cutting, no bleeding, only radio surgery is in vision. I think he's so happy, his wife is so happy, he's fully intact, Caroline doing what he wants, he's so happy. And I too, that's the sweetest moment of each day, he's having success for patients, and luckily for every treatment, our patients have a lot of success, and we thank God for every moment of their success. This man is now in remission, avoiding chemotherapy, avoiding therapy, avoiding surgery, avoiding brain surgery, avoiding hospitals. This is how he's fully stage 4 cancer. Doctor tells you have it, she tells you have it. Chemo for life, for surgery, for faster. But always calls to do choice to get information about who's secure, no sure. I come off the terrible with friends and neighbors. No, listeners save lives. I know the fact. I see patients on his own, and he's told to come here by listener like you. So radio listeners save life. Even our website is listenersavelives.com. Listenersavelives.com. If you want, we can talk about cancer, cancer, you like where your treatment's called. We can call us at 212 choices, 212 patients around the world. We're here to get better care, get money-based care, to understand more about diseases, learn about all the options. By reports about Harvard cancer, Dr. Jeffrey, OTP, Broadway. I was going to say, about 4 years ago, I started cancer, the hospitals, we gave some treatments, and then you have family emergency, and you have treatments. Yet half the treatments, well, having half treatments in my territory just doesn't do the job. So this man never showed up at the hospital, never called, never arranged, never signed anybody, never understand that half the treatment would not lead to successful outcome. Well, so you get yourself, that's working at the PSA, love test, that's what you measure success after special cancer, remember that you basically go down to 0. Well, this PSA was not going down to 0, it was rising. After treatment, you see the neurologist, other neurologists, and you see the hospital, no, recognized the fact he never completed the treatment until he came here, and came here, got all his records, and I told him about, he never finished treatment, never complete, but he gets over the never complete, and forced better to receive all the treatment in one series. We are offering treatment to try to resolve his cancer before it gets out of control. We staged him up, we staged body cancer trial in 0. In 4 years, we did that, he was mobilizing doing treatment to try to contain his cancer. This is the work that we do every day. We love cancer, recurrent cancer for this man who was never treated. This is work we do at the Broadway in Harvard City. She was 70 years old, born in New York City, and she has 2 skin cancers. I saw her this week, 77 years old, bank. She had biopsy showing basal cancer with the tip of her nose, another basal cancer in her right cheek. She had a history of a left lip skin cancer treated with surgery, and she does not want any more surgery. She has 2 skin cancers in the tip of the nose and the right cheek, and she wants non-invasive treatment. We see some people with skin cancer face and swing cell cancer. Most people in the course of face has cancer, the face gets lots of shoulder, and most people believe it's not responsible. But often we see people with skin cancer in the hand, feet, arms, trunk, back, and chest. That's the primary areas of the body. And fast we're able to treat high success rates, non-invasive, not the most surgery, which is a slicing, slicing of the cancer of your body. Our patients like their body intact, it's still cancer, but you thought intact, and that's what we do. So many patients, you get a book examples of skin cancer, eye, nose, ear, and mouth, and other parts of the body too. The whole team uses non-invasive, easy coming treatment around home, work, cutting, patching, flaps, wraps, transfers, blood, knives. Our work is non-invasive, high success, that's why we both her nose cancer and her cheek skin cancer as soon as possible. And we see many like that. We wish to say non-invasive cancer treatment. That's why I'm 4 years old, 8 years old, he's black because Jamaican, black community, 1 in black men will get prostate cancer, and 1 in 23 black men will die of cancer. Government check this, most likely there, and you're asked to help, of course, you say yes, and that's part of why we're right now is to indicate to every person, black, white, and race, that you get cancer, and certain groups have higher rates of cancer. This man's 58 years old, he's married to 3 children, he has prostate cancer, diagnosed with PSA 7. We just he had a biopsy, his PSA went up, and with us, and now his PSA is 0. Like he's happy, he's happy, cancer is number 2 is like 4.30, it works. He was with surgery, open robotic surgery, the success rate is less, and the complication rates are astronomical. From this damage to sex life, urinary life, with open robotic surgery, again, you're a shorter course of treatment, more effective treatment, and a better quality of life. You have a book with DVD, right? To send you, call our office at 212 choices, 212-246-4237, 212-246-4237, and that's the book with DVD or appointment. If you want your very shy person email, you send me an email, Gil@rsny.org, Gil@rsny.org, and answer your questions. Always has to come in person. This is the work we do. We return cancer. He also office book with DVD appointment, several insurance, I was going to say, in Florida. He flew to Mass, area, and I sat down and spoke with some of Mass, what they have at their Tesco, and so to the scrotum, and it was never like here, came back to the mice, first we got biopsies, as we mentioned that, and it turned out to be a cancer the size of a golf ball next to the scrotum, and we staged my bacterial cancer trial, because large cancer trial, and spread causes harm, and we found no scrotum cancer. This is my surgery, I think all the options. This is your treatment is all beams of radiosurgery to cancer. And the options, we followed command and treated the all 2 years ago. 2 years ago, I did 2 years ago. And while we're treating this big mass, surgery here for me, completely melted away large mass as a golf ball. Next to the scrotum, as well as penis, obviously, is only hard for me to head up, and we surgery forced to be on this mass. And anyway, and it's really came this week for a fact. I see, look at the last day, and I come here to talk to you. Why I want to mass too. He's supposed to focus on only, claim, surgery claim, all the treatments. Only this is what he's now cancer free for yourself. When you say his whole body, there's no evidence of cancer anywhere in his body. This is the work we do here at the Cancer Body for you. And the woman who's the worst, she's a child's sister, and years ago she had the breast and positive lymph nodes, but for the super big hospitals, we often talk about this, the big hospitals are such a push for medical surgery, big surgery, 97% of women, the hospitals are mastectomy or breast cancer, whereas in my practice, 90% of women were keeping their breast. I believe everyone should give all the options, but she wasn't really an option. They told her she had that surgery, even though she had positive nodes, he pushed her out surgery, and she had that surgery, and then they got another breast, like we breast, and breast, so we thought that the breast didn't get this little breast either, and then she was traveling, and she started to have chemotherapy while the surgery replaced years of chemotherapy, and chemotherapy caused her kidneys shut down. So she was 57 beautiful woman, both breasts and operated on, let her move. She had a mastectomy, and I knew she did not need that. Okay, choose it for one as a choice, of course, everybody's trying to do what they want, but some people not even all their choices. And what she came to because her sister, first doctor was my work, and sister was telling the doctor that the chemotherapy gave her super big, causing kidney failure, shut down, causing 3 hours, will be after an oral chemo because the other chemo causes kidney failure, and was working, and the cancer was growing, and she was showing the cancer traveling, and just pain from cancer. So, hey, cancer treatment caused kidney failure, cancer treatment is not working. 5 years later, it's a long ordeal. She comes here for treatment for advice to get better, pain. And of course, I wish she came here earlier, so we could have avoided unnecessary lunch or 2 surgeries, multiple surgeries on the breast, which is important cancer travel, the treatment costs so much destruction to her body. Okay, our cancer treatment where we attack breast cancer about 90% of the cancer go away very high in the breast and elsewhere. And you see so many with breast cancer, primary cancer, even prior surgery, chemo, radiation, them all has failed in this field so painfully. Okay, we scale from United States grandson, the prostate, so cancer, surgery, radiation, surgery, in other cases, another surgical prostate stories, surgery, but is no more surgery was done 6 years ago. He's been constantly years. In some cases, to the surgery in New York City, on the basis, no work affected well, cancer back, and now it's here with the try to get better. The price has no treatment work there. Well, the treatment, learning treatment, diabetes, blood pressure, surgery, one places in New York. So we're stating about measures no other cancer. I'm not surgeons rushing to surgery when you come out, which cancers, that's all the options available for recurrent prostate cancer after surgery. And if God, because surgery prostate cancer doesn't work, there is no method to give you a second chance to be cancer free. And many men come prostate cancer, prostate cancer, permission to send it even to send you, so it's too much work for prostate cancer, no charge to you. A man who came from North Carolina, 76 years old, had prostate cancer 2 years ago, getting medical surgery, had medical surgery, it works, he has 555 years old, with bone metastasis, he did treatment cancer bones, left hand, cancer pain, cancer shoulder pain, so all the options. And another myself, we come here to get better pain. You have cancer pain, you're best seen in person, so solve for consultation. Also, about a sad story. She came 3 years old, her mother, friend, 20 years old, she was honored student, and she came, and a year ago, she had decreased hearing, just found with a scan, had to have acoustic neuroma. Now, her surgeon told her that she should need surgery. Her surgeon never told her about all the options, about non-invasive options. Her surgeon never told her that Lederman has the largest experience with acoustic neuroma, fractured non-invasive radio surgery worldwide. And thus, most likely people have high quality of life success. No, she never told any of this. She had surgery for a benign tumor in her head, acoustic neuromas in the hearing nerve from brain stem to the ear, nerve impulse hearing, hearing impulse now, or for balance, or she had tumor on the nerve, and the surgeon never told her options. So, she went to surgery, and she was left. She was blind in the eye. She was patient paralysis, she had face, she was super, the food was falling over her mouth, she can't close her mouth. She can't breathe on her own, so the fatality is to her neck, hold it, close the airway, and she can't eat, she has a feeding tube or a peg, and she can't walk. All from surgery on brain, which could have had non-invasive treatment, and most likely continue her normal life with a high degree of quality, keeping her hearing, keeping her vision, keeping her face, and not eating a tray, not eating a food, and keep walking. And that insult injury, literally, the tumor itself, there, the surgeon cut her and damaged all those nerves on her brain stem, all those nerves, she's not blind, deaf, able to breathe, eat, or walk, and now the tube's back, that way. This is what we're doing, that's why we say so important to get fresh second opinion. No matter what, patient requests a few treatments, treatment, play on the tumor, and based on large surgeries, world fracture surgery, to run cancers, first with brain surgery, examine brain surgery, all the cancer trials, well, not just for not people know better, looking for what to get only surgery and not beware, not offer you loved ones, non-invasive treatment, so sad, they use bad words rather than offering treatment. They words refuse to surrender treatment. They let their wife, their child, whose first kid, brain surgery, security started in New York. Guess what? Whole passion brain tumor, all the package, open DD, brain tumors, cancer, brain tumor, metastasis, cancer from the brain, and quarter brain have brain metastasis here. Here's a call about non-invasive treatment, cancer, brain, the ear, eyes, nose, senses, throat, neck, the entire body. This is a pioneer work we've done. About for 20-year-old who people suffer from the rest of their life. Because surgery, like deaf, blind, eat, breathe, or walk. So there's a lot of reasons why brain body surgery to you. And the largest surgery, the first experience comes with body surgery, all non-invasive treatment. That's the university we see many people with losing respect cancer, mind brain, two surgeries, including rheumatic illness. So one experience is called 2 choices, 2 46 42 7. We look several choices like medical issue related cancer or suspected cancer is best to be person. It comes to 2 choices, several choices like medical. Usually thinking of my personal jail and artist, my network, jail artist, my network, questions comes to 2 choices. The science of the practice of treatment, organ, heart, lungs, kidneys, stomach, trained and board certified in number 1, and trained and board certified in medical oncology, came to medical school, and trained and board certified in radiation oncology, board 9 years after medical school. I know some doctors are not board certified in anything, so like them. Some doctors are board certified in too many doctors, 12 certified hard trained radiation oncologists, I know you work in the world. What's the benefit to a patient if you were to your neighbor, someone else? Well, the benefit is lots of experience. 30 years of practice in oncology, in oncology for almost 40 years, and get a lot of experience with doctors, experience thousands of cases, thousands of families, thousands of treatments, experience all in one brain, and you have that. That's a good where we treat people with cancer or suspected cancer. Even if, for example, treatment chemotherapy, radiation, surgery doesn't work or doesn't want it, there's some people that surgery don't really want. There's some people who aren't able to live without this happening. I see every day, right now. Yeah, cancer comes to doctors, so they have to and it's like. And you're refused to hear about hospitals like you. And there's some examples, some women who have to lose their breast and they come here for 24 hours for different options, different choices. Some men in still have that possibility have medical advice here, results inferior, and complication rates are off the wall. It's another reason why so many people come here to 1384 Broadway, and the hardest thing for treatment Broadway, close to subway trains, buses, people across the country, and across the country, so convenient, so Broadway, the Broadway between these times there. So everybody I see every day, most of them come here to talk to you, but not. You can learn to talk to medical results on TV, and basically or go there. This is the work you do. This week, nothing obviously you don't know the details, but roll them, or the symptoms, what they therapy. And it's quite interesting. Listeners do save lives. No, you can save lives. You can save lives. Listen, we're not saving all life. That many people come to I've listened to your show every week for years, and we're talking for and now the information you give me has helped so much. So this is going to be a speaking, man, he's married to a young contractor. He's has a heart disease, heart sensitive, heart sensitive, heart sensitive,
doctors. Right? He's going to the biggest hospitals, seeing doctors. Well, the doctor told him his PSA was the last check, was 4 or less. The doctor told him his PSA was 2,800. Yeah, you heard right. He would go to the biggest hospitals, biggest doctors, sorry, for cardiac scans, for medical care. No one ever told him his PSA was off the wall. He was 20 to get biopsy, check out the carcinoma, and his contract was working again. It was terrible back and pain. And he got started on formal therapy. He got started on testosterone. He temporarily reduced cancer. He got started on his PSA. Got better. He so intractable pain. The past cancer refused cancer tried to use elsewhere. And his chemo doctors are also going to chemo. But no talking about how to get rid of the pain. And he had a percent like you on narcotics. And sometimes people depressed and feel bad. And often causes constipation. Hormones, and chemo, and narcotics. But pain is still there. And I can tell you, I actually did chemo doctor. Actually, the pain would send to the past radiation. I couldn't know what that is. But no sense. He's in pain, terrible pain. He moved up from sitting, standing, lying down. He's in terrible pain. And he lost a lot of weight. About 243 pounds. Terrible physical cancer. Growing. Eating weight. Body weight. So it's well. You can't be sure to be okay. No. Then the cancer ate his body. Lost 43 pounds of flesh. As cancer growing. And narcotics for that. For blood pressure. The pain. The movement. And he wants to get better. He wants to get rid of the pain. This is the work we don't talk about frequently. That so many cancer patients are pain. It's ignored. Pain is terrible. There's no reason to ignore pain. Cancer patients. It's another reason why so many people come here for treatment. Consultation. We determine what's the issue. Speak to the patient. Examine the patient. Define the patient. Family. This man is pain suffering. This is where we really pain suffering. And send invisible beings to attack cancer. Just through treatments. And most commonly, overwhelmingly, stop the cancer and stop pain. Just what most people want. Straight out cancer and out of pain. So this is what we do every day here at 24 Broadway. We do this every day. We do patients with primary cancer, primary site where cancer started. As actually like this cancer controls the bone. This is finally under the other hospitals. Never got heads up. His PSA was high. I spoke about it. He fell through cracks. And now his pain falls through cracks again. No one cares. His pain passed away. What I said, well, he's doing home therapy. He's doing pain. It's not helping him. It's not helping him. Only work temporarily. Chemotherapy only works temporarily. We know that. So here we are. Just remember. And you suffer from no suffer pain. Cancer pain. Cancer pain. Cancer pain. Those reasons cause you today. Or any other except most insurance is not our office number is 212 choices 246 4237 independent free cancer center. They're for you. Not the recommendation for the hospital, not the surgeons. No, we have one of us, and that's you. You have to take most easily access to call our office 212 246 4237. The number. New York Times highlight great surprise cancer in man. One sister man, prostate cancer, and prostate cancer, prostate cancer, prostate cancer, more than 10 years old. Said died of prostate cancer before medical and now observed from radical surgery. Prostate cancer, the minimally high success rate to avoid radical and surgery. Maintain sexual control. Let me for prostate cancer screening. Entry call 2 choices frequently DVD to call by the choices 2 choices for and secret exchange my life. Choices can make it 13 for Broadway. Call by the 2 choices go ahead. Many people cancer come to surgery to help chemo stop working. Many people cancer come to and the caregiver has no care to offer. Pain innovative cancer care for decades. But the next choice is not promised. When surgeries fail fast, many able to offer you new cancer treatments. You can never cancer, small or large, most anger, body, even if chemo, radiation, or surgery. Call doctor 2 choices for free book and DVD. Radiation, most insurances, we can accept conference training, short work certified doctor 2 choices for innovative cancer treatment. Best is me in person. Call 2 choices. Well, that's your this is Robert Sanders, Dr. Leederman, and we also this is and the doctor who gives conscious people cancer. So a patient one is also a doctor who's conscious necessarily with what is that? Well, we give cancer things actually quality. It's not sure the talking about ceilings, working, and it's not people conscious enemas, rips, and just doesn't work. And probably people hopes that they believe or saying something, and yet they're saying things that are not true. So what happens? The doctor was encouraging people, honest people, with cancer to get concussions that don't work. What happens when that doctor himself gets cancer? The question might be overrun by that. All people who do scans, they also get cancer, and they do their own concussions, or they go to a doctor. And get real treatment that has the best chance to work. I'll just worry about that man. He's 5 years old, he's 0, he's not children, and the ear will be large around the neck. He has a neck, a mass of lung, but tomatoes, with biopsies, have cancer. Get cancer markers, so his blood test, blood, there's how much cancer is, and blood elevated cancer markers, we see 99. Usually cancer marker for the pancreas, this man is a marker for his head and neck cancer, and he has CEA, which is general cancer, marker 3. His CEA was 114, so about 35 times normal. And he tests scans, drug tests, sees his neck. He had a biopsy, showed squamous cancer with the tongue, it's trouble in the neck, and he's concussions. Well, he's concussions, also talk about preps, enemas, vitamins, and oxidants. And the reason why I tell these things, watch those people cancer, maybe like your friends. Now, he never talks about throat cancer, there's other dynamics, 50 and then right now, there's a human papillomavirus with cancer, remember, like my blood does have cancer, mouth, after he said he finds oral sex, and he has oral sex, and there's another man, Jamie Dimon, who's one of the Hispanics in America, also has throat cancer, so he has desperate, middle-aged men, not necessarily smokers, traditionally, throat cancer is not cancer, cancer is that was a new picture, a new cause, the cause most likely is human papillomavirus. So another teaching point is, if your children and grandchildren are vaccine now, you give your children and grandchildren vaccine, so they don't get less likely to get human papillomavirus, and all the cancer associated with human papillomavirus, cervical cancer, anal cancer, and this bifid cancer, throat cancer. Wait a minute, tongue, neck, he's also conscious. His weight was 254 pounds, 190 pounds, 30 pounds, 40 pounds. So you can imagine, doesn't need cancer needs fuel to grow, and whereas the fuel takes from that person's body, so eating fat, eating fatty muscle, eating fat, cancer eating fat, also because cancer of the tongue, it's hard for eating, because move around, get the teeth, chew up, and digest. And also many people with cancer of the tongue have pain in their ear, because the same nerve goes through the tongue and the ear. And sometimes he says blood, there's another teaching point about the blood is a warning sign. So he had multiple warning signs, he had a mass, he had weight loss, he had pain, he's a elbow sign, and he never got the treatment. Okay, examined him. He has fist size because of the treatment right now. He's not able to move his tongue out of his mouth because the cancer is so massive, it's just sticking the tongue down the structure of his mouth. He can't use it. And he's literally open his mouth. He has both the right and left neck. And it's squamous cancer. And it's from 1.5 months, like what to do. But he came here after a year and a half, fussing around. We had a test, and one of these scans was whole body, so maybe traveled this whole body. And we offer all the options you have. Well, surgery, options, cancer so massive, you can't get the whole mouth, it's not an option. Surgery, hospital, chemotherapy itself doesn't care what the throat cancer is. The best way we can approach before we use this is what we do. We take on many tough cases like this, massive cancer in the throat and neck. Even our office, we go to the actually doctor came to us when I had Georgia with massive cancer like this. We actually doctors on the stretch going to the operating room of these hospitals. In New York City, there was the operating room. Always on the sheet. I seen before. Always in that stretch going to the hospital. I'm always out of the room. He changed my stretcher. He came on the stretcher, wrapped on the sheet. Because he came to Dr. Lederman for our treatment. He did not want to have radical form surgery. He had our treatment and went in complete remission. He sees a picture on the wall. He sees a picture of a book we call office at 2 stretches. They don't put nothing. We have so many people talk about because we see so many people all over the world and try to help everyone that we can. That's why I want to help people. And this is what we do. It's not the companies, not the hospitals, not the hospitals, not the surgeons. We went to medical school to be able to help you and your loved ones and your friends and neighbors and everyone that people you know know trouble. And you come words to help them. You might want to help you get second opinion. If they're trouble, if they're well, if they can't about the treatment. So many of our patients have been referred by you and other listeners, and they're eternally grateful and thank you. And thank you for your patient, I know. Yes, Dr. Patient cancer, prostate, breast, lung, pancreas, bladder, primary metastasite. This is the work we do every day. Online medicine, how do you work with invisible cancer, without the high success rate, few treatments, highly focused. This is the work we first pioneered in America. This is exactly what we do. We have lots of patients send you over. Come to our office and for focus TVs, pass on to your friends and neighbors because you might be able to help save their life or already life save. Breast, bladder, prostate, brain. You have the ability because this is to save lives. How about this is to save lives? Primary cancers. Primary and small, large, multi-organ body. Even fire surgery, chemo, radiation is tolerated. We first of all, I surgery tumor, and hospital physician and radiation was okay. With again, invisible because cancer. Breast surgery is invisible, non-invasive cancer therapy. It's not hospital. No cutting, no bleeding, no hospital stay, and no anesthesia. We can experience most cancers, lung, breast, prostate, more. Fecal DVD, call 2 choices. We operate in person. Every day, every most insurance and Medicaid, every hospital physician and radiation was okay. With again, invisible call 2 choices. 2 choices. Prostate cancer news. New York Times highlighted risk of prostate cancer, black men, 165 million prostate cancer, and 1.3 million prostate cancer, 240% higher mortality. Offers 24 action. Coordination asks, colors also people with high prostate cancer and cancer risk. Prostate cancer treatment for decades for all. For prostate cancer, we recommend high success to radical surgery and sexual for prostate cancer screening, call 2 choices. Free both DVD2. Call 2 choices for your own and see our great results. Most insurance and Medicaid, 2 choices. So let's learn. Hours learn. It's medical school. You want more listen, more you learn. So doctors listen to many doctors use it for patient. Many doctors use it to understand what we do. Many doctors listen and then they come here to treat for themselves. And many doctors refer their own patients here. And they know that coming independent cancer has lots of advantages. That know the patient knows lots of communications in it. And it's still
stands not adulterated by lines of communication. So, also, independent free T cell cancer treatment center, 19 years old. She's 19 years old. She's a mother, and she had cancer of the adrenal gland. I haven't stopped kidney. She found out about 3 years ago. 4 years ago, she lost her menstrual cycle. And she's a gynecologist and a psychologist doctor. So she's with and system. And they worked out why she lost her period and found that adrenal gland. And she went to the super hospitals. And surgeons, they are medical, so they found out. And so how does adrenal robot we find? Well, that's what she was told. Something that. And mother told her. They override with a big machine. She got the adrenal. And cancer exploded in that robot machine and spread all over abdomen. Calamity, yes, it's calamity. Not equal. When surgery's done on cancer, she's done surgery with cancer, leaving cancer cells behind. Well, here, not removal, explode cancer, spread all over the contents. So the opposite exploded, so the opposite and that's hurt her. Wow, and shortly after the cancer travel, of course, because cancer still cancer, sometimes some certain cancer of the liver, this one is the liver, this one is cancer of the lungs, and then got her lungs, remember, it's not your girl. And they therapy, medical therapy, work for cancer. They say, why do you do it? Well, lots of reasons to do it. Because they get paid for it, bodies. I have $10,000 a month chemotherapy. So if I was rich for anybody, work on these in the hospital, everybody, that's the patient. And the cancer's got a person, getting a year, 1901, goes that way. And they got a belly, or they were this cancer, not cancer, they got over again. And again, they left cancer behind, got cancer. And they got cancer liver, and all the treatments, surgery, almost surgery, chemo. Nothing worked until she went about us. For a little she came and started seeing me now for 2 years. Treating her, life treatment cancer, focus videos, treatment to cancer, chest, abdomen, when the other treatments just didn't work. So you come here, you have chemo, it's been everything. It's like everything, it doesn't work, nothing. So she came here, finding treatment work. And why can I got her about? So you learn to understand. This guy's cancer, surgery, chemotherapy, long operations, the hospital, long, how does that happen? So they worked, none of treatment worked until she came here. And I take her away in New York City, and this is what we do. And I say, why did I do it? I was the first time I use a lot of criticism. Because other doctors always expect, so we have ourselves, even today, it's most robotic surgery, open surgery, move her lung, abdomen, and chemo, it just hasn't worked. So lots of reasons, every hospital, every doctor, every facility, of standard treatment was okay. There's one doctor who said, all the doctors on the hospital said, no, there's a better way to focus on cancer and not hurt healthy structures. And that's what body surgery is all about. Not based treatment, visible beings, possible things, attack cancer, not hurt healthy structures. That's not personally your chest, abdomen, above, chemo, head, toe, the rest of life. That's what we, that's why so many people come here. Cancer is real, and kidney, the gallbladder, the lung, the breast. This is what we do. Primary cancer. And lots of information, we send you. If you wish to call our office, say we want to go for brain cancer, body cancer, prostate cancer, or if you have cancer, yourself, or suspected cancer, just make an appointment. Call 212 choices 212 246 4237. Have a look for your black woman. She's married to children, lives in a home, and 3 years ago, massive size of right. And doctors go with the and the two of them cancer. Size of 7 years old, 18 and a quarter. And she's never bad, staging. And she's all kinds of concussions. Another victim scans, she's all kinds of concussions. He's 17 and they went into the about secrets. Then cancer is the back. It's growing. It's suffered. She's 10 years old, cancer growing in the muscle, below the breast. That's what we have muscle, your muscle, and often cancer spreads under the cross muscle. Spreads under the cross muscle, the armpit. So this is also 45 minutes. Recurring theme is that cancer is growing these calories. Cancer will eat anything to treat it. To your body, inside the cancer, growing cancer. Don't always mission is to grow and take your life. That's all it knows. We have one mission is stop cancer. Reverse cancer, really, you're all not easy. So I also want you to fix the armpit. Your right armpit. It's a massive reverse surgery left side, okay. She had cancer and so she came here for you. Finally, she came years after concussions, scams, and nothing worked, nothing better. I was able to stand the rest now. I was treating. And this is what she's done. She's not really, she came to me. Measurements, we were going to send this breast cancer. All of them, we don't believe. So lots to do because we have always many patients with cancer who are just not comfortable with the chaos in their life. They want to simplify and explain. That's what we do every day. Give advocacy for women. New York City. You know, what's on Florida for years. He said, why? It's no myeloma. Myeloma is a tumor of the bloodline. Generally, causes pain, controls the bone, causes their pain. He weighs 93 pounds. He goes down another mark, because he has evidence seen by scan. Our treatment tries to help him. And we see it because PSA most recently is 0. Another good result here at the treatment. Another patient, lots of men, lots of cancer, they make it more than 6 million prostate cancer, more than 1 cancer. There's lots of cancer, prostate cancer. In Caribbean, there's 6 years old, he's had a son, he's got 10. He's losing 6 cancer, and people can be cured. This is the work every day, why themselves, because your life is such a life, amazing quality life, it's so true. Woman, there's a chance to have best chance to be cured.
You know, treatment, you really have likely to be cured. You know, treatment, breast cancer, breast cancer, breast cancer, she refuses psychotherapy. She's had 8 months of mind. The best is timely go treatment, that's liver, our treatment, surgery, all being focusing, bacteria, cancer, minimize harm. It's totally like chemotherapy, just chemical, it's totally like surgery, just mechanical removal. This is invisible, high stress, brain cancer, stroke cancer, kidney cancer, prostate bladder, you name it, you find your concentration, send you have 2 choices, it's all off 2 246 you go online, listeners-save-lives.com, you gotta believe you can save lives, listeners-save-lives.com. You want to meet with your person, emails, gil@rsny.org, gil@rsny.org. Stay tuned, learn, be smart, study, learn, And so, last year, and cancer, and review the cancer, the body. All cancer in brain, cancer, the body, all cancer stage, or only radio surgery, no chemo, no therapy, no cardio, no surgery is in remission. Like, he's so happy, he's so happy, he's fully intact, he's carrying on doing what he wants, he's so happy. He's like to the sweetest moment of each day, he's success for patients, luckily our management, our patients have lots of success, and we thank God for every moment of their success for this man who's now in remission, avoiding chemotherapy, avoiding surgery, avoiding brain surgery, avoiding hospitals. This is how he's fully intact with stage 4 cancer. Dr. Kelsey, chemo, life, surgery, cancer. We also call student information, we lose charge. Make our office, make the experts, friends, neighbors know that listeners save lives. I know that for a fact. I see experts, and he's told to cover by listener like you. So radio listeners save lives. Our website is listenersavelives.com. Listenersavelives.com. If you want to take on your cancer, all your treatments, one calls excellent choices. 212-464-37 of patients around the world. We're here to get better care and understand more options to learn all the options. Control over the heart, cancer, cancer, 4 years ago, I was cancer, we went to the hospital, gave him treatments, and then he had emergency, and never had the treatments. Yet half the treatments, well, having half the treatments in my territory just doesn't do the job. So this man never left the hospital, never called the brain ship. So anybody better understand that half the treatment would not lead to successful outcome. Well, it's not really the opposite. You're saying but it's not radiation, but it's not the PSA blood test, PSA blood test, that's way to measure success for cancer, whatever we have to, PSA will have zero. Well, this man zero is rising. After treatment. We see about another and see about no, he never completed the treatment, so he came here about doctors, and he's told him about you never finish treatment, never complete, but you never complete, and of course, after all treatment series, we offer treatment to try to resolve the cancer, we focus control, we stage 1, we stage 5, we stage travel zero, in 4 years, we did that, cancer still localizing, treatment to try to contain his cancer, this is the work we do every day, we do cancer, return cancer, for this man, we stand believe it. These days, we do it for everybody, very hard to see. Everyone knows over city, and she has 2 skin cancers. I saw her this week. Sometimes she's working for a bank. If I see based on cancer for nose, based on cancer for my cheek, and the three skin cancer for surgery, and she's not lying surgery. You have 2 cancers for the nose and my cheek, and she wants something based. We see so much more skin cancer, and squamous cell cancer. So stay with the course, based cancer, it's lots of exposure, and most people believe it's responsible for lung disease, hand, feet, arms, trunk, back, chest, the rest of the private areas of the body. And as we're able to treat the high cancers, non-invasive, not the Mohs surgery, which is a slicing of the cancer of your body. Our patients like to keep the body intact, and use methods to kill cancer, leave the body intact. That's what we do. And so many patients, and you get a book, examples, skin cancer, eye, nose, ear, mouth, and other too. The whole team uses non-invasive, easy treatment around the home work, high passion, flash, raps, blood, knives, or works non-invasive. That's why we want to treat both her nose cancer and her cheek skin cancer as soon as possible. And we can do that. We're saying non-invasive cancer. Now, 4 years ago, we take all these black acids, we make them in the community, 1 in 6 black men will get cancer, and 1 in 23 black men will die of cancer. Probably make that with there, and you ask how, of course, you say yes, and that's right. What I'm right now is that it's a 30% black, white, and race that you can get cancer, and groups have higher rates of cancer than 58-year-old female. You marry 3 children, the prevalence of PSA 7. Please test cancer, you get biopsy, when PSA up, and if it's and PSA 0, and it's half twice the average cancer. We're 2 seconds worse, so 3 0 worse. He knows that surgery over surgery, the success is less, and complication rates are astronomical, tremendous damage to sex life, very life, over life surgery, so cancer for shorter treatment, more effective, and other quality and the and send you call office at 2 choices, 212-246-4237, 212-246-4237, and that's what we do. You can person email, you send an email, gail@rsny.org, gail@rsny.org. Your answer questions always has to come in person. This is the work we do. We work on cancer. He's called the email, in Florida. He put him in the Massachusetts area, and I sat down and spoke with him. I have a third testicle, and so that's like the other treatment. I just run for your half, causing bleeding. And came from Florida here for evaluation because he wanted to find out what pain was mass, and didn't know that he was mass. So I examined him. And it was 5 centimeters, just about 2 inches hard fighting mass, extra scrotum, and the third came here, came miles, first to we went by this mass, we went to that. And turned out to be a basal cancer, the size of a golf ball, extra scrotum, and we said my cancer travel, cancer travel, and spread harm. And mother stage 1, and found no cancer. We surgery to others. I'll give it all others. Now the unfortunate is open surgery to this cancer. And we found he did follow this cancer and treated him. This is all 2 years ago. 2 years ago, 2 years ago. And we're treating the state mass, treating the surgery properly. Completely not the way large mass size of golf balls. Extra scrotum, that causes obviously is only harm to us. And that's we surgery focusing on this mass. And anyway, it's freaking up to for a second. I see I've seen this case and come here to you. And I want to mass review. He showed some clinical chemo surgery all the treatments. Only this will be now cancer free. We got we said there's no evidence of cancer anywhere in his body. This is what we do here after 24 hours. And we're going to see some people divorces and child cancer. And you know she had breast cancer, nose. She was super good at hospitals. We talked about the hospitals just for surgery, big surgery. 97% women have hospital mass cancer. Whereas my practice 90% women keep breast. I believe we should give all options. She was given options. She had that surgery. She had positive results. He pushed that surgery. She had that surgery. And they cut the other breast. The other breast. The breast. See over each one of them. My cancer did doesn't look either. And then she started traveling and she started doing chemotherapy. Super quick here. Years of therapy and chemotherapy and therapy. Kidney stones. She was 37 beautiful women. Both breast and not removed. She had mastectomy. I believe she did not need that. So she once choice was therapy. That's why we're not all their choices. And well, why did she come because her sister was her doctor, and the sister was telling the doctor that chemotherapy did was super big sales choices causing kidney failure. She was out of the house. She was out of the house. So oral chemo is something causes kidney failure. And the cancer growing. And shot cancer travel. And just pain. She's pain. Cancer travel. Cancer treatment. Kidney failure. Cancer treatment is not working. Finally, years later, it was long ago. She comes here for treatment for advice. Of course, I wish came out here to avoid that. So we also the rest. She's working cancer travel. She's so much to her body. In our surgery, where we have about 90% of the time, cancer is very high breast and elsewhere. And she's only breast and breast cancer. Even for surgery, chemo, radiation, chemo, it's failed. It's so painful. What was cancer for use cancer? And our process of cancer after surgery, surgery, no surgery, prostate surgery, implants, and no or rashes surgery. That's years ago. He's constantly years for years. Now the so surgery, years ago, the work that was out, asking back, what and now it's here for me, trying to get better. The right has no to do the work there. Well, yeah, it's ready to treat it. Not ready for surgery. So say you want to make sure there's no other cancer. Other surgeons, Russian surgery, cancer elsewhere. All the options are available for current prostate cancer after surgery. And if everything after surgery, prostate cancer work, there is nothing to do with second hand free and many men come with cancer, side cancer. Information sent to you. You want to send you. It's cost to do your office. It's no charge to you. And man who came from North Carolina, 70 years old, he has cancer 5 years ago. And medical surgery after surgery, work because it was 55 years, even a bone passes, getting infusion of cancer bone surgery. Not cancer pain, not cancer shoulder pain, all options. And as a mother myself, you can come here to get therapy. And cancer pain, you got to be different. She's called for it's a really sad story. Well, when you murder friend, she's 20 years old, she was understood, and she came in a year ago, she was found with a acoustic coma. Now her surgeon told her that she should need surgery. Her surgeon never told her all the options. Her surgeon told her that even the surgery was fraction unexpected role with most likely people have high quality life success, not just mental illness. She had surgery for a 9-tumor area, who runs to the brain, the sound, to ear, the transmits nerve, impulse, hearing, hearing, now, or valves, the tumor, 9-tumor on that nerve, and surgery her never turned her options, 20 years old, and she had surgery, she left deaf. She was blind eye, she had facial paralysis, she had face treatments, super drink, food, whatever, she closed her mouth. Can't breathe on her own, just out tube, hold the airway, and can't eat, she has a feed to her peg, and she can't walk. All surgery on her brain, which could have had non-invasive treatment, and most likely continue her normal life with a high degree of quality, keep hearing, keep her vision, keep her face, keep her face, keep walking, and that is something very literally, for herself, there's a pattern of all those nerves on her brain stem, all those nerves, she's like blind, deaf, able to breathe, eat, walk, and now there's back, no way, this is what we do, and so we get software to fresh, second opinion. No matter what, having bless you, and treatment, treatment, people without super, and based on large world factor surgery, for first brain surgery, take brain surgery, so in Charlotte, well, not this person, not nowhere, the fuck, on surgery, everything, and you are not for you, almost, not treatment, so sad, these bad words, but not treatment. They bad words, refuse to treatment, they don't brain surgery, most serious after a year. That's all. All packed up into short calls, package, brain surgery, cancer, according to the habit passes a year. There's a call about non-invasive brain, ear, eyes, nose, sinuses, throat, and neck, infected thyroid. This is a bad but done for women, 2-year-old who was able to life, because surgery left deaf, blind, eat, read, or walk. So, less reasons what brain body review, or the surgery, or footprints, or body surgery, all non-basically. I'm talking about for many people, cancer, cancer, non-brain cancer, 2 stages, Jones. So, cancer is caused 2 choices, 2 first stages, 2 several churches, medical issue like cancer, or cancer is best to meet person, causes 2 several churches, which is emails, first aid, shell, and artists, yellow, artists, first hospital, first. Changed his mind. He actually came to Dr. Lederman for our treatment. He did not have radical surgery. He had our treatment and vision. He was wall. He was the office. He was so many people. That's just communication all over and try to help everyone that can. That's why I help people. This is what we do. That's the drug. It's the hospital. First, the hospital service. We went to school to be able to help you and loved ones and friends and neighbors and everyone else. Really love you. If you cover words, you have to make one get second. If you trouble, think about treatment. Some of your cases are heard by you. You're really grateful. That's it. Thank you. This is what we do every day. All night. How we work in invisible people. This is the work we first pioneered in America. This is exactly what we do. Lots of friends said you will and you write it. Ask your friends and you have my website. That's what I brain. You have the ability to save lives. Some doctors use doctors use the same way. Doctors doesn't come here for themselves, and doctors refer their own patients here, and they know that kind of independent lots of advantages. They know patients, they know lots of communication, and it's close, and it's not operated by lines, not patients. Lots of advantages, and if you deep cancer treatment, cancer treatment, I will do all these. I need all these days. How much is it? And he actually I had about these like about it's about 3 years ago, 4 years ago, cycle, and she's like, and system, and they were about she's period and fast plan and super quick hospital, and there's only about 6 hospitals, so like constantly know, fine. Well, that you solve that. They have about a machine, and the answer is floating that robot machine, and all over abdomen. Surgery is done. Surgery is done. Cancer treatment. We're not going to spread all the other so the opposite, solid goes out the pressure. Wow, and it's really travel across the cancer and lots of sometimes it's the liver, so it's the liver, so lungs, and then top of the lungs, there's nothing to do. This is therapy, look at it. Why they do because they do because they get paid for prostate. Average $1,000 much more than so. So there's great body, and cancer every year. Many women beautiful, and they have better body. They have better body, cancer again. Again, that's behind cancer. And liver, all these surgery, chemo. I think we're cheap for us. Looks like you can't take for 2 years. You're going to stabilize your cancer, focus basically cancer just happen when the other treatments just didn't work. We're going to come here, can't really do everything. Look at therapy, it doesn't work. Just can't hear. Just find a work. And I'm going to you learn that. Just the cancer surgery, large, the hospital, Olympics, hospital heaven. Doesn't work. None of it works. Just can't hear. It's for university. And this is what we do. And I say, why do we do it? I just bring leadership. A lot of you love Chris. He's all about like doing have something. He said no surgery, open surgery, whatever, and keep chemo. It just hasn't worked. So lots of reasons. Every hospital in every facility. A standard one doctor. All the doctors said no. There's a better way. The focus on cancer and not her healthy structures. That's how you surgery. Not this body because that's what cancer, not her healthy structures. This is not more like your chest, or like we do go. We come here. Yes, the bladder, breast, lung, breast. So we organ. This is what we do. And lots of things you send you to our office. So you want to bring cancer, body cancer, breast cancer, work. Cancer, cancer, cancer. 2 choices. 2 choices. 4 2 3 7. We don't make patients like women. And there's the children in the home. And 3 choices. The breast size break. And doctors move the lung and lymph nodes. And 2 cancer. Size cancer. 7 years of each important. And check out cancer. And all kinds of cautions. To move from scans. So make a caution. 17. The violence of procedures. We can just report back. It's going. Discomfort. So that can year cancer below the breast. That's why no muscle. Muscle again. And all the breast under muscle. Starts the breast muscle. This is what we do. For everything is cancer. 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 Other reasons to be afraid. Keep body size. Cancer. No other mission is to grow and take your life. Some of those. We have one mission is cancer. Reverse cancer. All not basically. That's an answer. But surgery okay. So cancer. So options. You can't get rid. Finally, she can't give it. Cautions. Scams. Nothing works together. No one understands the power. This is what she's done. She's not really cancer. She must be sending the means cancer. All the way. So us too, because we always many patients with cancer, which is not comfortable with the gas in their life. That's why I explain that we every day through New York City. But it was on 7 years old before 4 kids. He said, why? Chemotherapy, myeloma. Myeloma is a tumor generally causes pain, controls the bone, causes pain. This is 93 pounds. He doesn't have nothing remarkable. He got expensive evidence, CT scan, off treatment, happen. We see it. CT scan usually is 0. Some other good results are different. One patient beyond that, lots of men, she got cancer, cancer, Jamaica, Lederman, 6 breast cancer, more than 1 breast cancer. There's lots and cancer, breast cancer. In the Korean, expensive solely, son is 10. His music cancer. And he wants to be cured. This is what we every day. Why he himself, cancer, life, his sexual life, and his body life. So good. So all 9 months, she left breast and the doctor just four family members, including mothers that she never got herself. The big signs she got that, and she was massive doctors and everyone else. Even the positive, and she had no people. She went to 30 years later. Small. That's not like this. Well, you know, people are here. Oh, indeed, very good. Take all right. It's not obviously our occupation is the market. Obviously, we're just going to and all the rest is already got the rest. Across the rest is the rest. And there's just more. But it must. And it's going to also basically we have to take 30 days. You see, after good for days. Anytime. And that she said no treatment. No people with breast cancer have high rate of stage drop. That's the rate. Visible. She's the first time visible. I believe she needs treatment. She can try cancer. Cancer. The same way she's alive. Who refused observation. Cancer group. As well as the breast. Either breast cancer. Breast. Even breast cancer. 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 Mass outside the breast. Cancer. Cancer. Stage 4 cancer. We have cancer. For second. Cause two choices. 2 2 4 6 4 2 7 2 2 4 6 4 2 3 7. Both of the cancer. Cancer. Challenge 1 is cancer. Breast cancer. Cure. No treatment. You're not likely to cure. Treatment. Breast cancer. Breast. Liver problem. She refused therapy. She's an 8 month. The best is time to treatment. Liver disease. Our treatment surgery. All visible. Pancreatic cancer. No harm. It's not like therapy. For example, she's surgery. This is visible. High stress. Cancer. Kidney cancer. Prostate bladder. You name this. We're doing pioneer. Classic percent. 2 choices. 2 4 6 4 2 7. Go online. Lister save life. You can save life. Lister save life. You're right. avoid brain surgery, avoid hospitals. This is how it's fully different. This is how and trained in board certified in Chicago for 9 years after medical school. Some doctors not certified anything, so for them. Some certified one, 2 doctors. They're board certified trainers in college. Only work for so benefit to be able to do experience. Well, that's experience. 3 years in oncology here. We're going to for almost 40 years. We allow experience in doctors around. Experience 1,000 cases, 1,000 families, 1,000 treats, experience on one brain, and you have that at the board patients, people with cancer or cancer. Even if really bad chemotherapy radiation surgery has worked or something, some people get surgery on one. Some people are moved like with hospitals every day, and cancer is always public house passes like. And you feel your hospital and some people have rest and come here and take for different choices. So many minutes have to find out that the board is fear and cancer on wall. So many people are hard to explain the runway for the public space and the offices can talk about the runway for space. So we see patients every day. No one come here to talk to you about going on. So learn to Dr. Edwards on TV. Crazy world. Go there. This is where we do it. This is where we patients talk to you about the details. But you do better. And so there's two life. You can save life. You can save life. I'm saying all and people have I'm sure every 4 years. And now the information you gave me has helped much. So let's go about Suzuki and numbers. Maybe it's contact with the process is also from doctors. Right? Well, they also well, I'm going to hold the remote kids. Let's try to more. I'm going to hold them. This is 2,800. They were right. These hospital doctors are hard. Stands like no one ever told me that all 200 advice each other and these contractors again. But they're back and that can really. And because of hormone therapy, we can really reduce cancer. Even though it's battery still in track pain, that's the end of the cancer chest be elsewhere. And the result we need to go with more pain. And it's not because it's people press and do that. And often consultations doing hormones and chemo and narcotics. Pain is there. We take I do patients do pain with some of the patients realize no things in pain therapy move up. Same thing in the therapy. The other way we try to learn road cancer road ways body weighs 34. They just make sure you now. The body 43 pounds as cancer road. And it's right percent the pressure of the run. Feel pain and pain movements. And once you get better, you want to get rid of pain. So you talk about frequently that some cancers pain and pain more. Against therapy, we do pain patient. There's no pain here for body patient. What's the issue? It's the patient pain. The pain is work really pain suffer. It's an invisible impact cancer. Just treats and some overwhelming stop cancer stop pain. Which is what you want. It's really and get of pain. So we do a day here everything for body every day. It's a primary cancer primary second started. But that's like this cancer from home. Because they have 800 cell people never got heads up. It's just high one. Over about it. We fell through the price. And it's pain also the pain in the best possible. Why say well, the other pain. So we know the muscle work temporarily, only works temporarily. So we are just remember we so far some use our pain from cancer have muscle weight bleeding. Supposedly some office cars today or better yet except with insurance that okay. Our office number 212 choices 212 which you add recognize the hospital surgeons no was yes you as a hospital easily get to this across 212 choices and the doctor who gives cancer. So he's one, but he's also a doctor doing cancer, not necessarily people certain magic blood, cancer, coffee, or vitamins. No more damn. And also people find vitamins and rips, and she doesn't work. And possibly has to leave or saying something, and saying things not true. So doctors encouraging people, with cancer, get cancer doesn't work. What does the doctor himself? He has a cancer. So why not get rid of that? Also, we'll do exams, and also get cancer, and they do their own practice, or deals with the doctor. Real treatment that has the best circle. 65 years old, he's single, children, and the year ago, he had a large mass in the neck. He was in the neck mass of the lung. There's males with cancer, and mars, who has blood, they have cancer, and blood yellow, starts with C99. Usually cancer for pancreas, this man was married for his head and neck cancer, and the CE is different from 3. His CE is 114, 35 times normal. And he has cancer, the neck, he had breast cancer with the sun, it starts the neck, and they start cancer. But he started cancer, and these guys sells these things. Once those things, people cancer, people friends. Now, never smokes, cancer, 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 50 point. And then now this make women virus, like cancer, remember, like my cancer, mouth after treatment, said oral, I got oral sex, and the Jay Diamond, several of these American cancer, so that's the middle age, and unnecessary traditional cancer, now a new picture, a new cause of life, you can have a virus. Well, this is if you have children now, your children vaccine, they all have a virus, all cancer, you can have a virus, and cancer, and this is cancer. First man that was found in the neck, he lost conscience, he was 254 pounds, about 90, about 50 pounds, 50 pounds. The dimensions that needs fuel to grow, whereas the fuel takes from the body, so you got fat, muscle, you got fat, and eating fat, because it's time, it's harder to eat, you need time to move around, to get to up, and digest, and also both with time, have pain ear, because the goes to the ear. And sometimes it's another teaching about blood is one side. But also his mask, he had ways to pain, he's a couple of times, and he never got the treatment. This side, he has a few minutes, he's able to lose time out of his mouth, he has cancer so massive, so he's not down to the streets of the he's literally over his mouth, and also both the right and the neck. And it's cancer, really from a month and a half, he's like, what to do? Well, I came here, fuss around, look at it, and I did the same, so I got a lot of extra travel. And we're all got to have, so do like so massive, he kind of is off, so possible. Chemotherapy stuff, not for cancer. Best way to go and coach, focus on this. This is what we do. Men talk like this, mass cancer, mouth, throat, neck. In the office, pictures of cancer, when sports, and kid. We actually was stretcher in every room of these hospitals. In New York City, the patient through all honesty. So we're that stretcher going to the hospital, all over. He changed the stretcher. He put the reference passed his name to Dr. Our treatment, not medical surgery. He had our treatment, and in the minute, he's a picture on the wall. He's a picture of the office at 2 choices, and people learn about him. That's all people talk about. Has to see all over the world. We should help everyone again. That's why I want to help. This is what we do. It's the hospitals, the students, medical school, to help you and us and friends and neighbors and men down the street. If you come here, help them. You want to help them. If you think they're trouble, well, then I can't offer treatment. Some patients provide you and others. They're generally pretty sensitive, but so we can't do it for cancer. Primary parasitic. This is the work we do. One label. How do we work with this have cancer? The highest review. This is the work we first pioneered in America. This is exactly what we do. Other information we have 2 hours. Every probably guys speak. Have friends and neighbors. My body and house. Like all things. So that's you have ability because this is safe lives. I was just save lives. But I do back. Cancer treatment center before Yes, a woman, she's 19-year-old, she's a college student, she's single, she's a mother, and she had cancer of the adrenal gland. I had to kidneys went bump kidney. Started about 3 years ago, 4 years ago, she was in Mexico. And she's a oncologist, and an oncologist doctor. So I moved to and endocrinologist and system. And they work by GE period and by the adrenal gland, and the surgeons are big because no, that's no body fine. But I was told that. That was a big body machine. And cancer exploded in that body machine and spread all over her abdomen. Calamity, yes, it's a calamity. She's going to surgery, cancer, she's done removed the cancer. Well, here, not removed, exploded, spread all over the so they exploded, so they probably are in the first. And so they're actually around the horse because they're so good cancer as well. Sometimes surgeons are so it's still the tumor, they lungs. And then power lungs, there's no and they don't work cancer. So why they do it because they get pharmaceuticals. I'm $1,000 a month from there. So you have to rate for everybody. The companies not everybody, but patient. And the patients have progressing the air, they're really nice one, beautiful, really successful. And they have belly. Remember, they have cancer, cancer, and they again. And they love cancer behind the capture abilities. And they got cancer work. And all these surgery monsters chemo. And work until she was about us. They're like you. She came pregnant now for 2 years. Treating her same much cancer. Maybe we can check happen when the other treatments just didn't work. No, come here, you guys. So everything. Including robotic therapy. It didn't work nothing. So she came here. 34 hours. She managed to work. And I came here up so you can learn that. So you got to go advanced research, chemotherapy, blood pressure, and big hospitals, long, big supposed to happen. Does it work? Technology work. She came here. And take for and this is the work too. And I said, why not do it? I was talking about America. A lot of use a lot of criticism. The other also respect the 200 over Republicans have not even that. Even today, he was asking for the surgery, over the lung, rather than chemo. It just doesn't work. There's lots of reasons. Every hospital, every medical, every so. Standing with one doctor, so those doctors on medical said no. It's a better way. Focus into cancer and not hurt healthy structures. That's what body surgery is all about. Not just being that's like tap cancer and not hurt healthy structures. Does that sound more like here? Just have another chemo panto for your life. That's what we do. So make you come here. Cancer, kidney, bladder, breast, lung, breast. Every organ disorder, we want that cancer work. A lot of patients go to the DCU, if you wish office to brain cancer, body cancer, breast cancer work. If you have cancer, cancer, just make it call 2 choices, 2 choices, 4 2 3 7. Every labor 67 for 1. She marries 2 children in the home and for semester size and doctors move the and they move and 2 of the cancer. Size is 3.1 centimeters in quarter. And she never got a cancer, and she's all kinds of conscious. Other witness cancer, so many conscious. B15, vitamins and access, vitamin C dress. The cancer is brought back. It's different. She has to go to the hospital breast. That's about browsing man. Officers, I'm so. That's under the hospital. So lost by 2, before 2. Recurring thinking is that what is running these calories. Yes, we eat, keep your body temperature, cancer, cancer. Most of it is take life to the nose. We have to science to risk really good stuff all on easily. When I was when she said armpit, your right armpit. I think that's my better okay. They cancer, but options you can't care for treatment. Finally, here options scans and work nothing better. That's another special power. This is what she's done. She's not really she can't fight. She must be facing this type of cancer. Oh, no, we don't know. Lots to do because we have post make cancer worse than the face in life. They identify and explain and we every day they're every day for New York City. That's why I'm 7 years old before I was with kids. He said, wife, take care of my myeloma. My mom said, with the line, generally, because pain troubles alone, pain. He weighs 23 pounds. He physical exam, nothing remarkable. He's actually happened, steam, FSCN. The offer treatment right now. He succeed. If he recently is 0. Other factors don't give anything. Money from Ghana, lots of men, black men, every cancer, Jacob Wynn, more than 6 men, cancer, more than 1 cancer, there's lots of cancer, breast cancer. And the 60 years old, his son, his pen, his cancer, and he wants to be cured. This is the work of the day. Why he got himself cancer, life, so he's so improved. I didn't move back. Cancer and radiation or surgery just doesn't work. How research is precise non-invasive. Your work teams and radiation or surgery is how they not be crashing at therapy or alternative. Yes, there's often non-invasive options like radiation surgery. You have to go through everything. I know something on my father, which I believe in treatment. Two choices. First America, I have no patient. Is there non-invasive treatment? I believe I did first 30 brain cancer. Two choices. That's meaning from heart. So when you're losing as breast cancer treatment, just put cancer breast. So breast cancer education about talking about breast cancer, breast cancer, and side and radiation. That even have and first brain cancer, breast cancer therapy over the day. So you need to call two choices. Two choices. Breast cancer treatment. Most choices are professional. All the breast cancer treatment. Two choices. All the day. Many cancer treatment healthcare loss. Cancer cancer days. Cancer not surgery was failed past. Many able to cancer treatment options. Treatment and cancer slower. Most and even prior to radiation or surgery. Two choices. Two choices. For people being only choices. Medicare Medicaid. Artificial trouble provide treatment. Two choices. Two choices. Cancer treatment. Cancer treatment. All two choices. Two choices. I have a student who has a high stage. It's 3 5 non choices and you have. Came in here with cancer treatment. About 3 cancer. What cancer? Because the cancer. So have to say rising. So it's for cancer. We're going to be the result of options. Of stream. But that's on in your life. And I want about a woman who's 9 years old. She has she's widow and she's office on breast. And she's told she's mammograms doctors. So the home. So the treat patients. We treat patients believe patients deserve it. And it's going to be second cancer. Patient feels so this patient needs obviously and call back. He's like men have 6 chances of cancer. It's a very number. 1 in 6 cancer. 1 in 23 cancer. We're talking about it, so you warn you. You warn every time one of the cancers you have cancer. Go to the we say mammograms, screening tests, smokers. There's lots of reasons why. As we found 4 years ago, cancer before 4 survive, and it's all getting treated. So we have 4-year-olds today. Treatment 40 years. Not case 39. Almost 10 times more normal. We scores 9. Very scores 5 cancers. The highest standing on is very high risk. Very high. And decrease urinary flow. Because urinary flow. Better exam. It was rock hard. It's hard. Hard. So I say it's high. We score. They say you must treat exactly. How line picture? No, leave line. Everyone should get treated. Everyone should to make sure you get treatment on your So we do every day here. When I was 6 years old, she's married. When I was 6 years old, she's married. And assistant cancer she has. So it's pretty far. So almost 9 months she fell up in the left breast in the upper inner quadrant. She never had mammograms. There's 4 members. We noticed she never got mammograms. The big warning sign she should be back. And what she got was mass doctor mammograms on biopsy. Then the lymph nodes were positive. And yet she went on chemotherapy. She was small. There's not chemotherapy. It's not about. She don't take therapy cure. No. And she didn't have the benefit of taking chemo. Nothing was people chemo better. Obviously, our radiation is markedly for the breast area. For the cancer in the inner part of the breast. And all the lymph nodes are already for the inner part of the breast into the lymph. And we start to check out work. That's 8 months. And so busy. So busy. She's 8 months. 8 months. 30 days. Because if we got today, so 4 days now. Well, yeah. And yet she said, no treatment. No people with possible cancer have high rates of recurrence. We say you're not going to be visible. She was not visible. And I believe she needs treatment. She needs treatment. Trying to for the doctor. And same day, she just like refused focus. It's true. That's what the breast needs. That's either way the cancer is right through the inside of the breast and skin. That's about stage 4 cancer. Second, I think I'm in first cost 2 choices. 2 6 4 2 7 4 2 7 over the year. The cancer. She likes woman. There's a chance that chance to be cured. You know treatment. You're not to be cured. That breast cancer. Breast cancer. With a woman, she refuses therapy. She's taking therapy. The best is timely, but treatment that's for her to surgery is all visible. Focus means to attack the cancer. No matter. So chemotherapy example. Totally like surgery. Cancer removal is invisible. Being high success rate. Cancer. Kidney cancer. Prostate bladder. You name the work. You require lots of research. 2 choices. Causes 2 choices. You go online at listeners.savelives.com because you can save lives. Savelives.com. You want to get directly to my email. @rsny.org. Get out @rsny.org. Take a learn. It's a pleasure. For cancer, not
you. Uninvasive outpatient highly successful cancer. Whenever you have a standard is okay. I have a first surgery. His cancer, surgery. Cancer, brain, body, prostate, lungs, cancer, performing surgery. You can have cancer treatment. Make sure 31 active services for free DVD calls. Presidential cancer treatment. Life is open. You and you can call cancer. My second human, I born and raised in the United States in Iowa, where my family for 4 years lived. I was school there, lived high school, MD, doctors, physicians, physicians to heal their doctors, doctors, a little bit, I don't know, incompetence, so I was got a doctor, and sent some money to Chicago University, and the money to the wall, so the fact I was actually some real doctors were many years, decades, early morning reading and studying, and I was weekly how I used to really study. Remember, I actually was doctors, so I was part of the profession, but today, and medical school, and trained for years, and it was Chicago medical certified, and then I medical school, and studied and trained college for 3 years, and board and 3 more years in Chicago medical and board certified. Chicago board most doctors board certified, board certified, 3 years, I do provide more information and certification. So I issue of probably more to each patient. If you feel that there's a year for cancer, issue of breast or frequentation, high cancer, lung, liver, prostate, bladder, primary cancer, lung, bag for black liver, care for patients with cancer, keep chemotherapy, surgery workers, when there's a lot of people surgery, we just about it, and family of hospitals as well, hospitals, they don't know why they go to hospital, can't well, if you have together and supplement you got the line, you can't put every you have choices about yourself. Most people need to understand that that's the needs of certain surgery, people don't you need not all the patients, see patients most commonly, when you're not tell patients all patients well, it's after the doctor reasons that we take that we work out a different way with the way we here to serve patients. That's why the medical people better. That's how radiation is really important. So inform, educate, understand, the patient understand better, just have them come is in Florida, surgery, seeing the doctor, going to see, somebody don't know who they are. Or no, every patient I don't need for email or phone or go doctor random know. Here hundreds of hundreds of remember. And also I remember past my friends because know that patients, listeners, learn things and teaching. That's why I'm here on the radio for a reason. That is to do I know board certified, board certified, cancer. Because 34 I need to car there and I get information I work. Car office 2 reasons. Number 212 means radiation means check for radiation and and see that I the patient had injuries, doctor from and it masses next to the same the workers sales office and he said that's he was I didn't have to like his neck. I was working for like ET, right? He looked neck and he had a cancer. He only in the hallway in the hospital, make a course taking out on the sheet. And he would go all the elevators to the operating room. So on and decided to come back to me. And the other day, around the sheet, other day, now the hospital. I was expected to see me. I was surgery. I decided to go with you. I want to go surgery. And this man had surgery. She's on her book. He comes all the way. Arguably in their office. He called off. He's back. For now, surgery. You have a solution to that. Okay, nobody wants to each other. And I say because he's not there, doesn't change your mind. You have to always change your mind. Then I change my mind. He's happy. Live cancer free and all things. Men do work, love, and travel, and enjoy. And he's all after our not being free. Well, when I moved to the story, and you're simply him. He's 60 years old, married to a fellow New York City police woman. He has 2 daughters with his wife. She's a sergeant in the police. And he had 10 cancers. But long, never really year. But he had a year into this. I never smoked. Smoked with cancer. Never father was a smoker. And so that's another age point for you. Also, smoking you'll live 9 more years. So a lot of evidence by smoking. If I really your parents, stop smoking. I should have your family. What can smoking experience? And you're going to talk about education. You're going to the hospital, and what has problems with surgeons? You got to have surgery. You have to go. When the hospital, it's not like surgeon. What goes next? Got to get kidney cancer. And this man, yes, I was number 1 is to know that kidney cancer doesn't mean you have kidney. We people kidney cancer every day with high cancer. With no kind of you don't know that kidney. That's certain. That's super hospital. That's how that he could see. No, he told me why certain patient don't option is kidney. Maybe it's surgery hospital. I think the patient should have told their options. There was options. And he was option. These are information. Then the patient came back. He was on cancer from the lung. But they were saying for something that for us is because kidney was lung. And then came back to cancer from the lungs. He's in the lung. So he lost the surgery kidney chemotherapy. And he was up. He was weight loss 20 times wide. It's because he cancer in his body. And then he came and he tried to everything. He decided he should not want to there. And I thought he was second stage 1, 72-year-old leaders. From the intelligence and community, we have stage 4 cancer, 32. For nothing that he's nothing to deserves cancer. And he came to me and showed how real 32 is multiple lung nodes. He's not still cancer, only. Slowly at all, cancer from cancer, back to therapy. You don't want that. You don't want the side effects of chemotherapy. Chemicals are bodies, therapy bodies, those types of therapy. You don't want cancer. We're doing cancer, hunting cancer. Usually, the later starts to be 97% success rate for kidney cancer, the lungs, treatment for asthma. Our teams still work to do for primary cancer, cancer, cancer. And what we cancer from the one, we just radiation, we just field. No, we do point treatment, body, computers, body, function as well. We have cancer, and that's what we did this last year. And then his wife found me up, and she says, husband's dizzy, fall down, and stuff. That's okay. Immediately come here, early in right, probably has a brain metastasis, cancer system. He traveled anywhere, he traveled with brain, he had surgery on kidney bladder. So we stage up, traveling, kidney, hospital, again, the same model. Surgeon, sister, policeman. You have to have that cancer from very high. And patient remembered. And this patient, so this married daughters, not many women have. Came immediately, saw him, and he also used to pressure rate, and it was a low dose. We all did not take the surgery. I saw him get a higher dose, and while I was seeing it within an hour, that's why I got better. Then we got all the time, his wife, was all the cancer, and he also and we also speak, but they also anesthesia. We some doesn't cancer. And then we're using that we lungs, now what you have, that's what we do. In just to be standard treatments, you don't have savage drug or death. With us, you have few chemicals like people who are angles, attack that cancer in the brain. So we're the first people me, first in your brain, every hospital, every facility, every doctor, our standard treatments, what brought, stereotypic brain surgery, deal in years levels, friends, versus police. We have a lot of years experience in your first year brain surgery, cancer, no anesthesia, you can stand the appeal. And treatment, you got to be crushed, brain, whole lunch, is able to be fully intact every day when people avoid brain. And this is just last year, getting me yesterday, and I just reviews new scans, body. And all cancer, brain, cancer, body, all cancer stage 4, have only surgery, no chemotherapy, no cutting, nobody, only surgery, in admission. I'm so happy, and it's fully happy, really wants to be happy. And I do, as a sweet moment of each day, is successful patients, like without treatment, our age time, that's and we for every one of our successful exams, avoiding therapy, avoiding brain surgery, avoiding hospitals. This is how we can fully stage 4. So better have your chemo life for surgery, or have your chest. We also call some choices. First, we will charge. We come out of the listeners say lives on your faculty, see patient and sold covered by listener life. So radio suggest your website is listeners.com, listeners.lives.com. And what they do is like your control. You want to call that 2 choices. So do 4 6 4 2 patients around the world. We're here to get better care, not care, understand more diseases, learn about all the options by over cancer, care, people. I can tell you we have treatments and then you family and you know the treatments. You have the treatments well, half the treatments in there just doesn't do the job. So man, there's a hospital call range anybody to understand that half treatment not lead to outcome. Let's go to New York City, which is like that's radiation doesn't seem like it's working. Let's say let's get anti the point of measure successful working my graduate that issue 1 to 0. Let's say there was 0 nice average. Even though another process anti the hospital no anything never completed you know here here all the I told about you never finished but you show up the hospital never and fourth after all the in series you're offering treatment which is cancer because of control you stage cancer troubles in before years we did that cancer local being treatment to try to contain cancer this is what we guide for the cancer recurrent cancer was now treated
Almost 40 years. He allows her to Experience thousands of patients, thousands of families, thousands of treatments, experience all in one brain. And you have that 34 hour patients, people, cancer, or surgery. Even if someone treating chemotherapy doesn't work as much, how many surgery is the right one? Some people get arm, everyone else does this every day. I mean, right now, if cancer comes to house, like just pull out the office and it's like, and you see about hospitals are like you. And so many women who would pull out the breast, they come here 34 hours with different options, different treatments. So many men with prostate cancer have radical prostate without the radical surgery will start inferior and how much off the wall. It's not so many people and hard to explain by theory, probably also subway train, possibly across the country, and end up neurologists, so they're also probably so probably between somewhere. So every week I see patients every day, most of them come here and talk to you about what's going on. So you have to learn to get better in the some people. They take you. Go there. This is what we do. This week, people learn all the what roll them, roll them, roll them after it. It's this is to save lives. And you can save lives, you can save lives. I've seen all night. And people have listened to the show every week for years. And what I mean for self information gave me has so much. But some men, so I'm speaking to many youngsters. He's very for his wife. Contact me. Has blood disease, heart disease, lots of problems. Heart disease, blood disease, right? You know, the hospital doctors. Well, the doctor told me this was Renault because the blood test across the nose 4 or less. This was told him it was 2,800. He was going to hospital doctors. Heart cardiac stents right here. No one ever told his PSA was off the wall. It was 2,800 5G. Right out of our stomach. And his contractors were getting terrible back pain, hip pain, and he got started on hormones. He started with hormones. He was testosterone. Rarely reduced chemo. Had a little because I had so back pain. He had to defeat cancer. Chest. He was elsewhere. And his chemo doctors are also going to keep but no talking about pain. And he's done also blood fever because people often causes constipation. Hormones, like narcotics, but pain there. And I used to give him relationship with pain. Sense of relation. I couldn't do that. Health sense pain. Can't remove that. Saying lying down. He's terrible pain. He's lost weight for 40 pounds. Probably because he's always eating high. He was flat. So you can't make sure you no. Then the body lost 43 pounds of flesh as a cancer stroke. And done narcotic blood pressure, Lederman. Pain, smooth. And he wants to get better. This is where you frequently. So many answers are pain. There's more. Pain's terrible. There's no reason to ignore a cancer patient. It's not so many people here for about it. What's the issue? Speak patient, examine the patient, examine the patient. And this suffers. This is where we usually suffering. It's visible being practiced. She treats, and most commonly, overwhelmingly, stop cancer and stop the pain. She's about most treat cancer and get out of pain. This will be a day. Keep it for every day. Do this every day. Treat cancer, primary cancer. But I started this man with cancer alone. This is 2,800 million. City hospitals. We're has his title. Spoke about it. Fell through the cracks. Not pain. Through the cracks again. No leader saying the best away. For example, he's done hormone therapy. He's not so pain. Not helping. I think we know the hormone only work rarely. Chemotherapy works really well. So here we are. Just remember. And just overall, no use for pain. He's cancer pain. Bleeding. Those are the reasons our office process today. What we do or better get the point. Most insurance that can our office number is 222 46 222 246 4237 222 4237 in the 3 cents. It works for you. That's my company. That's the hospital. I'm certain. We have a boss, and that's you. If you want to easily get to us, call our office 212 246 4237. That'll be your number back.
News. New York Times highly research and no prostate cancer. No prostate cancer. I believe it's just 10 years ago. Say, I said the prostate cancer. We want to high steps to avoid medical surgery. Maintain secondary control. Like prostate cancer screen. Entry. Also, justice. Food. Some color. Justice. For your degree. HM. Most justice. Make it. For boy. Every color. Justice. We had it.
People cancer. Many help. Many people's cancer. Many caregivers. No more just cancer. When the cancer is not punished, the surgeon will focus. We make it offer you new treatment options. Which cancer is so large. Many in your body. Even fighting radiation. They were called. Vitamin. 2 choices. 2 choices for free. Heart rate. Heart rate. 2 choices. 2 choices for individual cancer treatments. This is the call. 2 choices. 2 choices.
And the doctor who gives you cancer. So it's patient number 1. So doctors doing conscious with what is that? And people with cancer is magic bullet, stop sugar, eat coffee, meds, red seals, no work saying, can help people with conscious vitamins, enemas, drips, and it's certain people are saying something, and if saying things are not true. So what happens when the doctor who's encouraging people, honest people, cancer, get conscious over, but the doctor himself gets a cancer. Good question, right? Everyone about that. All people with cancer, and also the cancer, and people are conscious, or those doctor. Anyway, Bill King has the best cancer. Here's a story about that man. He's 5 years old, he's 7 children, and a year ago, he had a snap. He was in the plum, with male, with cancer, he had cancer markers, blood test, blood, like how the cancer is, and the body elevated cancer markers, we see many times. Usually cancer marker for the cancer, this man is a marker for his head and neck cancer, and he has CEA, which is general cancer marker. His CEA is 114, so 35 times normal. And he had cancer, so this is his neck. He had cancer, swelling cancer on the tongue, that travels the neck, and then he had cancer. But he's starting to control the and vitamins, oxidants, and he's got these things. One of these things people consider like reasons. Not your smoke, for cancer, so there's other evidence between men right now. There's epidemic human papillomavirus, the cancer, remember, they have cancer of the mouth, after surgery, or sex, and cancer, and other common Jim Hammond, who's like America, so yes, the expert middle-aged men. So smokers, traditionally, for cancer, smokers, and also new picture, new us, so it's human papillomavirus. So another thing is, if you have children vaccine, and children vaccine, so they get slightly get human papillomavirus, and all cancer is human papillomavirus, like cancer, anal cancer, and difficult cancer. Or it's a tongue, and neck, so infections. He is with 254 pounds, 190, about 50 pounds, 150 pounds. So imagine when cancer needs fuel, to rub, and take the fuel from his body, so eating fat, he got the fat, his cancer is eating fat, so his cancer is he was harder to eat than tongue. Food around his teeth, and it's like that. Also need both, because have tender ear, the same purpose as the tongue there. And sometimes he's a blood, nothing like that, a warning on. So he had multiple signs, this mass, he had weight loss, he's had pain, he's all of these signs, he never got the treatment. I examined him. He has a fixed like this, right now. He's not able to move his tongue out of his mouth because he's so massive, just sit tongue down, no, the structure in his mouth. Can't use it. He's literally open enough. He's looking both right and left neck. And it's cancer. And he's probably for a month and a half, right? Well, probably he came here luckily after a year and a half, fussing around. And what I guess, why you have troubles or what? And you have all the options you can have. Other than options, cancer so massive, you can't basically go mouth, surgery in the hospital. Therapy by itself doesn't give you cancer like this. That's a approach. Focus on your test. This is new. We've done many cases like this, mass cancers in the mouth, throat and neck. And you call office and the doctor who's a mass Georgia, the cancer is. He's actually the doctor who's joined the operating room in New York City. Machines that were on the sheet. I see before. Why was in that stretch only? Hospital, all the other room. He changed my doctor. He got a sheet. We had named to Dr. Lederman, our treatment, not one that had surgery. He had our treatment, and in complete he's picture of wall, he's picture of office, and choices, and he had to so many people because we see so many people all over the world and find out everyone that can. So I was have people, and this is the work we do. It's not for the companies, that's all surgeons with high school. Please help you and loved ones and friends and neighbors, and then we really know you know. If you come to work, we help them. You might want to tell them opinion. If you trouble thinking about treatment, some are referred by you, others are internally referred by but I can tell you like I know. So I can for cancer, prostate, red lung, bladder, primary vascular. This is the work we do every day. All basically, how do we work with cancer from levels with high steps rate few. This is the work we first pioneered in there. This is exactly what we do. Positive rate send you very compromised, especially for and have your friends and neighbors you and be able to help save their life or life of their bladder, the brain. You have the ability to save lives. Our systems save lives. I'll be back.
Cancers. New primary diabetes, small, large, and if there's surgery, patients, or your body surgery, every hospital has sensation of okay, birth, and cancer surgery is visible non-patient therapy. That's not no hiding, no bleeding, no anesthesia. Weak sense, cancers, non-breast, prostate, and more. Super easy. Call 2 items after each office insurance today. Every hospital physician sensation of okay, we're again. This call 2 choices. Cancer looks becomes risk prostate cancer, black men, 1 6 prostate cancer, and 1 4 prostate cancer, 104% mortality. Offers 3 to 4 action. Radiation aspects because also help people with prostate cancer, cancer related prostate cancer, prostate cancer, 4 days for all. Patients will manage high stress rates, so radical surgery, and control for all. Prostate cancer screening, 3 choices,
So a lot of learn, hours learn, and medical, you learn much more, listen to more, you learn. Some doctors listen to this program, many doctors listen to this patient, many doctors use to understand what we do, many doctors listen, come here, return to the house, and many doctors refer more patients here, and they know that independent patient has lots of advantages, that we know each patient knows communicating with them, and it's close, and it's not adulterated by lines of communication. So lots of advantages of independent treatment, style cancer treatment, I think you probably just to us. One beautiful woman, 19 years old, she's a hospital mother, and she had cancer of the adrenal gland, above the kidney, just 5 years ago, 4 years ago, she lost her cycle, and she went to college, and also specializing in organs and organs and stuff, and they were why she lost her kid, and found she had an adrenal gland, they were super hospitals, and friends, you know, they are bipolar, that's all, and the adrenal, well, that'd be fine, well, that's just all, but they have a body machine, and trying to have the adrenal, and they exploded that machine, and spread all over abdomen. Calamity, yes, calamity. Now, teaching point. So, it's not cancer, oh, here, but that so spread all over the abdomen. So, the opposite, totally operates however that hurts her. Wow, and so, cancer, travel, of course, they cancer, so the cancer, a lot of people cancer very well. Sometimes some very well, this is exploded, some later cancer in their lungs, and then powder lungs, there's a 19-year-old girl, and they start chemotherapy, there's more they say, why do it? Well, lots of reasons they do it. Because they think they do it because they get paid for it, pharmaceutical companies, and average $1,000 not chemotherapy. So, chemotherapy is great for everybody, probably the hospital, everybody, but patient, and the patient's resting a year, for a year. And 19 years, really sad story. And they have everybody, remember, why is cancer, they got cancer. Again, they left cancer behind, got cancer, then they can liver, and all these changes, surgeries, all surgeries, no. Now they work, gee, there was like you, she came to Dr. now for 2 years, treating her, saving cancer, focused, making her protection, check abdomen, and the other treatments just didn't work. So I got my hair, everything. Everything. Rock therapy, it doesn't work, nothing worked. It just came here, they work, you're finally getting work. Why can't I work? You learn it again. You can go, sister, boxer, more, the biggest hospital in London, hospitals in Abdomen. Doesn't work, another treatment worked until she came here. It's a Broadway, and this is work too. And I say, I didn't know about you. I was with Dr. Migration, a lot of criticism. Because a lot of know it's great, we have support, which we have not, even today, so much for boxer, over lung, chemo, it just hasn't worked. So lots of these hospital names, every facility, the standard treatment was there's one doctor who's all doctors almost say, there's a better way to focus on cancer and not hurt healthy structures. And that's what surgery is all about. Not based treatment, no, doesn't tap cancer and not hurt healthy structures. This is not what you have your chest, abdomen, private chemo, private rest of your life. So we, so many people come. Cancer is real, bladder, gallbladder, prostate, lung, breast. This is where you primary cancer. And a lot of information we have posted DVDs sent you. If you wish to call our office, say what you want, prevent body cancer, prostate cancer, if you have cancer yourself, suspected cancer, just make an appointment, call 212-226-4237. But we make patients have life for women, generic children in the home, and 3 years ago, breast size and Dr. Movement, and they moved us into 2 of those main cancer. Size of cancer, 3.1 layers of patient order, and she got cancer, staging, and she all kinds of questions. Another victim of cancer, so many questions. He's 17 megabytes and accidents, but zebras. The cancer is never back. It's growing. It's suffered. She was 10 years ago, cancer in the breast. That's what happened. So, after and often cancer is 100,000 also. This is the armpit. This is what we do, 145, not 142. Our training is that cancer is cancer we eat, treat it, keep your body intact. The cancer is cancer. So, it's one mission is to grow into your life, that's all it knows. Or we mission is to stop cancer. Reverse cancer, really, you're all none. So, I was just messing around. We're going to that's the massive surgery. Okay, she turned to her options and came here for treatment. Finally, when she came years after concoctions, scams, nothing worked, nothing better. That was Johnson's original power treatment. This is what she's done. She said immediately she saw me. Measurements we were sending this obese cancer. All of them I so let's do because we have always many patients cancer, we're just not comfortable with the custom life. We'll simplify and explain. That's what we do every day here at 24 Hours. University. And we're doing 7 years old, very 4 kids. He has a wife. He has no therapy for myeloma. Myeloma is a line generally because pain, bone, because of pain. He's always 190 pounds. He has a exam of he's got massive women, which is vaccine. We offer treatment to help him. We see it. You have to get most recently is so other results here at 24 Hours. And one of our patients from Canada, lots of to make a 1 in more than 6 men cancer, more than 125 cancer. So lots of cancer, cancer. In Korea, he's 6 years old, he's a son, he's Japan. He's 6 cancer. And he wants to be for every day. Why he got results because he left his settled life, his quality of life, which is so true. Yes, there's been 9 phase options. surgery, which is capital. This is visible being high success, kidney cancer, prostate, bladder, you name it, the work we do, we're pioneer. We'll listen to you at 226-242-246-42. Go on and search SaveLives.com. You can save lives, visit SaveLives.com. Find me directly or something email, at rsny.org, rsny.org. This is Lux Mark, Dr. Leaderman, God bless you.
For cancer treatment, for effective, non-invasive, well-tolerated therapy. Dr. Leaderman, radio, first first you, body theory, cancer, cancer, no, without any experience, environment, and lots of cancer, cancer, positive extensions, you can get surgery, work, both are more successful, you can either form heart rate, triple evaluation, all 2 fresh second, which is the cancer, probably leads to body treatment, cancer-free after surgery, open surgery, the same reason as you, non-invasive, high surgery, that's cancer, no hospital, so we have generation okay. I don't have body, first body surgery number, do cancer with surgery, we get cancer, brain body offset, lungs, cancer, perform body surgery, that's surgery, you can have cancer, cancer, surgery, work, fertility, 4 8, most surgery, perfectly because one presidential cancer free. My life always had a you do, and let's do something. You call me shop like cancer, if you wish. I'm human. I'm born and raised in the United States, Iowa, where my family for 4 years there. The school, medical school, medical doctors, Dr. Real, doctors, physicians, physicians to keep other people, doctors, hospital, incontinence, I became popular on and sent some money to Pacific Highway University, and sent money to Dr. Wall, where he so Dr. Wall was actually money to real doctors, many decades, not years, decades, keep really only working, studying, and really how you do. Reading encyclopedia, reading encyclopedia, I was part of the presentation of the university, and school, and DMP, for years, and Chicago Police Board certified, and then the medical study and training, policy for years, certified, and then 4 years, in Chicago Medical certified, trouble board certified, both sides, certified, 4 years, why do deal with information and experience to my patients. So it was a issue of drug war to each patient. I think each patient will feel that there's a difference here for cancer issues as a mass, rather than I say, my lung, pancreas, liver, prostate, bladder, prostate cancer, bladder, here's the 4 body patients and cancer. You have therapy radiation workers, lots of people surgery who didn't want it, and you training, you feel hospital, doctors, army, prostate, bladder, cancer, lung, neck. They don't want to go down. If you say one thing about here, and some back here, it's on the line. They can't have your army, breast, whatever. You do have choices about it. Most people need to understand that there's personal opinions. Some just want to do surgery. You can't do it. Not telling you all the information. I see thousands of patients most commonly, and I do not tell patients all the why we start the doctor. There's a reason for it. If you're having a different wavelength, I'm going to keep the certification. I'm going to make people better. That's how I'm ready to surgery. Anything, but informed, educated, understand. Come here. I know what happens. Many people just blur. They can't surgery. Sometimes one honesty. Sometimes we are. You know, I patients don't see doctors. They're business. Put their name or email or phone number. Doctor, copy brand. No, here, 100 business. You can't copy the surgery. And like, you have to be friends with patients and leaders, learn things, and they can teach them. So we're going to get rid of one of these, and that is educate. So I'm worth my training doctor. With 34 hours, we call off day night information. Call off choices. Order 22 university and choices. You have choices. Stop radiation. When you have anything, you have choices. Choices. And speak like sometimes I had many years ago. I had the medicine that was nice. It's in the hospital university, and he's not sure he was talking about next gen neck. I was recording cards. People like ET, around ET looking neck, and they had a television. But I don't know cancer. And he was going on this hospital, and he was going to call you later. He saw what was going on. All of a sudden, he decided to come back to being and got the gurney. His name was on the sheet. Got the gurney. Got the me. And the surgeon decided with you. And then after surgery, on there, he comes all the way. Arguing or sorry, I was going to put his neck before and surgery. Beautiful, shows huge mass in that. No, he show. I'm excited because he's like surgery. You can't. The event happens. You always change your mind. And I'm smart, happy. That was free and did things and do it and love and travel and enjoy it. And it's all about basically making free. Well, and who heard the story and nursing police. I'll tell you him. Everything was saying. He's always married to a fellow New York police woman. And to stepdaughter of his wife, Jesus, and there's police. And he had kidney cancer. Special Olympic. He was in the hospital New York about a year and a half. When he had about a year, so like, he had a year, he was in the hospital. He never smoked because of his kidney cancer. He never was a smoker. And so he got second smoker. His father. This is another point for you. He's hospital today. He lived like more years. A lot of different things. If I had been your parents, your parents stop smoking. Those are society. Those are the only experience. And you're in the hospital. You're in the hospital. And also, my last one, also surgery. I can't cancer. Well, it's the hospital. It's not a surgeon. We call it. That's what it's called. And this man said, yes, no, it's about the one. Is that we know that kidney cancer doesn't have to lose kidney. We treat kidney cancer every day. High success. No, one thing about kidney. That surgeon in that big famous hospital did not tell the patient that he would save his kidney. He told him why the surgeon tell the patient only one option is lose kidney. Maybe it's the surgeon who's in the hospital. Like the patient told the word options. There were options. And he never doing options. He was very fearful. And the patient came back. And he was going to have to travel a lot. But they really say that person. They do have to 4 days. He got his kidney. Lots of luck. And then he came back chest x-ray cancer. The lungs. He's in all the lungs. Lung. Things about drugs. So he's got getting chemo doctors. He was up. He was losing weight. He's in power. It was like he was eating his body. And he came. And he tried some therapy. And he just not systemic therapy. And he saw him with cancer for 50 years. Wonderful man, big man, bunch of man, surgeon. Well, age 4 cancer, 52. From 19 is nothing to deserve this cancer. And he came to me, and he chose to have radiosurgery to these multiple lung nodules. He's almost having chemotherapy only. Slowly, it all sure cancer, cancer, brought back chemotherapy. Early. He don't want that. You know, sex chemotherapy. Chemical body, bodies. Chemotherapy bodies. All success. That's the body. You don't want to pinpoint radiosurgery. That's what we do with kidney cancer. Primary kidney cancer. Kidney cancer. Usually, the paper will just tell you about Lederman. So then the 7% rate for kidney cancer. The lungs. Treat radiosurgery by us and our team. Our research teams that we do for primary cancer, cancer, anywhere in the body. And what makes kidney cancer respond to radiation? More using radiation, we just fields. No, we can pinpoint treatment. All the computers, body, cancer, plasma levels, cancer. So we get to this. And then one day his wife phoned up and she said, I'm dizzy, he's falling down. And so I said, oh, immediately, the emergency room, right? Probably has a brain metastasis cancer system. He can anywhere and travels to his brain every day. The surgeon sleep doctor room. But we take not finalized. He does the hospital, the emergency room. Guess what? The same hospital. So comes in, says, sir, back to solution. You have to have that cancer from your brain very high. And patient remembered. The other patient, and she came to not want to have it. And this patient, so you please maybe 2 hours. Did not know what was came and see immediately. I saw him. And the other study was supposed to produce a pressure brain called steroid. And it gave him a dose. It wasn't able before. He got to surgery. I saw him out of my and while seeing it in the hour, and that was better. And then we all the options. Body, wife. We talk about all the options. Yes, we have also avoid surgery. Have only always being radiation. Letting go of anesthesia. Even hospitals with cancer. That's what we do. So we do it. I'm going to have. That's what I want you to do. And for the treatments, prepare for the path, we path. With us, give a few minutes to let out the ankles, attack the cancer of the brain. This is where we first hear. We meet first in New York brain radiosurgery. Every hospital, every facility, every doctor. What's the okay? One doctor, but stereotypic brain radiosurgery. Deep and neighbors, loves friends, and streets, policemen. And yet, long experience, the most New York. First in New York research. OPNs, all cutting anesthesia. Can stand the kill. Listen to treatment. God, amazing record home lunch. We ends up being fully attacked every day to win avoiding radiosurgery. And all that's last year. And he came to me this yesterday. And I saw him yesterday and reviewed his cancer, his body. And all cancer in brain, cancer in body, all cancer stage 4. After only radiosurgery, no chemotherapy, no cutting, no bleeding, only surgery. He's in remission. Okay, he's so happy. His wife's so happy. He's fully happy. Carrying on doing what he's so happy. That's the sweetest moment of each day. Is success ratio. And luckily, treatment, our lots of success. And we thank God for every moment of their success. Avoiding chemotherapy, avoiding therapy, avoiding surgery, avoiding brain surgery, avoiding hospitals. This is how fully stage 4. Chemo for your life, surgery over your chest. Where also situations information we send in charge. How about pick up the actual defense leaders? No, listeners say live with fact. You see patients on it, and told to be a listener like you. So radio listeners say live. Their website is listenersavelives.com. Listenersavelives.com. If you want to find your cancer is like where you're going. What calls that 246 we're here to get better care and take on-base care to understand more opportunities to learn all the options like triple heart transplant, cancer, surgery, 4 years ago, cancer hospital, we gave treatments, and then he found and
treatments, yet half the treatments, well, half the treatments in my territory just doesn't do the job. So this man never showed up to the hospital, never called, never arranged, never signed anybody, never made understand that half the treatment not lead to successful outcome. Well, some of the girls in New York City, you're also saying, well, it's working on the PSA, it's can do something. That's why they measure success rate for cancer, no matter what, the PSA was 0. Well, PSA was 0 was passing, first treatment. So you're just another and it's at the hospital, no, it's never completed the treatment. So you came here, I was right, it's polio. You never finished treatment, never complete, but you know, it's never complete. And of course, the doctors receive all treatment in one series. You're offering you try to resolve cancer before that. You say, you study travel to Europe. Before we did that, cancer cell treatment by tooth pain is cancer. This is the work that we do every day. We got cancer for current tender for this man. This technically treated. These days, we would about very high percent. Okay, listen to me, and she has two skin cancers. On 77 for a fine. If I see a cancer, then those other basic cancer. She had a history of left skin cancer 3 years ago surgery, and she does not want any more surgery. She has two skin cancers on the tip of the nose and the face. You want not to see so many cancer and squamous cancer. And by places, many cancer. It's not the exposure and completely responsible. But people cancer hand, feet, arm, trunk, back, chest, breast, and other areas of the body. And that's where it's treated high success. Not able to things that most surgery, which is assisting the slicing of the cancer of your body. Our people in active use cancer leave the body intact. So many patients taking their book poison to cancer, eye, nose, ear, mouth, and other parts of the body. The whole team is non-invasive, easy, come to treatment around. A home or work with passion, wraps, blood, knife. Our work is non-invasive. That's why it's we offer nose cancer in her cheek, skin cancer, as in the hospital. And we see many which is non-invasive treatment. Let's go for young years old, black man, Jamaica, black man, 1 6 black man will get prostate cancer, 1 in 23 black men will die cancer. Government will make there, and was help say yes, and that's sort of what we're talking about now. Indicate to every person, black, white, and everybody that you get cancer, and certain groups have high rates of cancer. This is 50 years old. It's very free. Children prostate cancer diagnosed PSA 7, leads to cancer. You see, when they up to us, and now it's 0. Because happy body, happy world cancer. Number 2 is sex, 3 0 levels. He knows that surgery is less, and complication rates are astronomical. Tremendous damage, lifestyle, order of surgery, for shorter treatment, more factor treatment, and better quality of life. Beach. I sent you call office at 226-4237, and that's what the appointment. If you want to very person, email directly, you can email don't and kill rsny.org, rsny.org, and just always has to come in person. This is the work you do for current cancer. He also wants to the appointment to tell churches in Florida. He went to Mass England area and got down and spoke with Mass. It's like I have a third and so that's right. He had no treatment. He had no watches. He was pain. He came from Florida here for evaluation because he wanted to find out why he was pain. So he was a Mass and didn't go back to Mass. So I examined him. It was a Mass 5 years. This 2 years so hard, such a Mass. That's was and was never evaluated before he came from miles. Was we got biopsies after that. And the base of cancer, the size of alcohol, still scrotum, and we stage much treatment travel, cancer, travel, and spread this harm. Not before anything about no spread cancer. We measure those how options. And I believe your treatment is well being so surgery like this cancer. And doctors indeed we follow this and treat numbers all 2 years ago. 2 years ago, 2 years ago. And we're going to speak Mass surgery for me. Completely away. Completely melted away. Our size of columns. That's the road folks. Peanuts obviously is one harm things that and that's what we're focusing on this Mass. And you know, it's tough this week for sure. I see all kinds of I've seen else now here. I'm on one getting to each only came on surgery all the peanuts only with this being now. He's 3 weeks out. We stage so hot and there's no other cancer need where this is the work you hear after you probably going to get you. And we're 7 years old, so he works in resistant. And years ago, she had branded tempers of those. So those were big hospitals. We're talking about this. Big hospitals, Fisher, radical surgery, big surgery in New York. And then some at big hospital before cancer, whereas America's and women were eating the rest. I believe everyone should all the options. People have options. So she had surgery, he had those. He pushed surgery, she had surgery, and they got other breast, but we reconstructed some other breast because we tried to rest. See over people that we did doesn't make her rest either. And then cancer traveling, and she got chemotherapy while we investigated years of chemotherapy and chemotherapy. And chemotherapy caused her kidneys to shut down. So she is 57-year-old beautiful woman, focused in operating on one mood. Yet mastectomy, I believe she did not need that. So she chose for choice, so everybody should choose the one. So some people want to all their choice. And what people because her first doctor knows my work, and this is telling the doctor the chemotherapy on this we're taking place cause me kidney failure. I was 24 hours and for like I say. She's on oral chemo because kidney cancer and cancer growing as best. Showing that cancer traveling and just pain cancer. Just pain, cancer travel, cancer treatment, cause kidney failure and cancer treatment is not working. 5 years later, after a long ordeal, she comes here for treatment for advice to get better pain. And of course, we wish to change things earlier, so we have avoid surgery, most of the rest, which is working cancer travel, she caused so much destroy the body. We say that our breast where we have cancer, 90% of the time we're cancer always very breast and elsewhere. And we see some breast cancer or cancer, even for surgery or small, it's failed. In this case, so failed. From this case, and use the result. And like prostate surgery, cancer after surgery, surgery, some other surgery, breast stories, surgery, implant, and no more rest surgery, years off. In constant years, and take on to surgery, places, the work that control out, can't come back, any continent. Now it's here for me to try to better. The right, this is how the work there. Yes, you already have treatment, blood pressure, blood pressure, and so we're taking pictures of all their cancer. Up to the surgery when she came out, cancer is elsewhere. All the options available for current prostate cancer surgery. And if surgery prostate cancer doesn't work, there is a method to give a second chance to be cancer free. And many men come prostate cancer information that we send you. Cost of choice for office and so charge to you. The man who came from more than 70 years old, as prostate cancer years ago, radical surgery, after radical surgery, the working case was 505 years old, with bone masses. He's introducing cancer of bones and blood counts, severe pain, there was severe shoulder pain, all the options. And loads of so many people come here to get better pain. With cancer pain, you have to be seen in person. She was called for consultation. Also, the girl, sad story. So, 25 years old, came to her mother friend. She's 20 years old. She understood, and she came and a year ago said she was hearing. She was found with some had to have acoustic neuroma. Now, her surgeon told her that she should need surgery. Her surgeon never told her about all the options of non-invasive options. Her surgeon never told her that her knee has large surgery acoustic neuroma. Actually, not radio surgery worldwide. And with us, most of the people have high quality of life success. No, she never did this. She has surgery for non-tumor and acoustic neuroma, tumor, ear exam, ear transmission, nerve, hearing, hearing, now, once with a tumor nerve, and the surgeon operated on her, never telling her options. Just 1 year understood, and she was at surgery, and she was left deaf. She was left blind at night. She faked paralysis in her face. She was birthing food, swallowed whatever. After she can't close her mouth. She can't breathe her own. Just she has a tube in her hole, goes back to the airway. And she can't eat. She has a feeding tube in her bag. And she walks. All for surgery underrating. When she could have non-invasive treatment and must continue her normal life with high quality, keep her hearing, keep her vision, keep her face, and not get that food to keep walking. And that is all injury. The tumor itself, surgeon cut her down all the nerves, underrating stem, all the nerves. She's blind, deaf, unbreathe, eat, or walk. And now the tumor's back out of the way. This is what we're doing. That's why I say so. Take a fresh second opinion. No matter what. She can question after treatment, treatment, go without it. Hey, based on large experience, world friend, treatment, tumors, first year of brain surgery, second brain surgery, so it's also well, for this person, not people know better. Well, she will fight to get only surgery and treatment, and not year, not our loved ones. You know, not treatment. So, that was not good treatment. With that words, refused to do treatment. 30 years later, there was their child, who's first second, maybe surgery most serious doctor in New York. Guess what? Oh, had to have tumor, call off the package, or DD, got rid of cancer spring, with so much power, passes to the brain, and quarter million have been passes up here. He was called non-invasive treatment, brain, ear, eyes, nose, systems, brain, and body. This is what we've done. We've done exactly what we're doing. We've done for deaf, lung, and eat, breathe, or walk. Those systems, brain, body, surgery to you. You're the one experience, your first experience of body surgery, all non-invasive. As I can for products, you may go with new answers, second, all non-invasive treatment, and so the first answer is called two choices. We'll do first, we example choices, make a medical issue like cancer, or cancer, best in person. He calls two choices, example choices, like who's email, personally, WL, and RSL, get RSL, or request two choices.
And now, Lederman.
is exactly what we have lots of percent of where you come from. Everything from our experience, these pass out to neighbors, you might be able to help save their life or life saver. The rest of the battle, right? You have the ability to save lives. Our website is lives.com.
This whole surgery is cancer. Remember, primary diet, long optimal treatment, even 5 surgery, chemotherapy, or already. We first radio surgery tomorrow. And hospital physician, dedicated of first skin, invisible cancer, radio surgery, invisible non-invasive, outpatient therapy, that's not with no height, no needle, no anesthesia. We consider the most cancer, lung, breast, prostate, more, frugal AD, call social justice, emergency, FDA, all first cancer, every hospital, radiation, okay, first skin, invisible surgery, call 2 choices, 2 choices.
Breast cancer news. People highlight witness of cancer, one in 5 will get cancer, and 20 will prostate cancer, 24 is higher without obviously for action, pretty much as well. Also, people with high prostate cancer, cancer rate, vitamin 3, cancer treatment for patients for all. Prostate cancer, we believe members high stress, so radical concerns, maintain sexual immunity, prostate screen, prostate immunity, choices, 3 choices, 2 choices, your appointment, and see our results. So, just make a choices. There's a lot to learn, hours to learn, and medical learn, more learn. There's so many doctors use this program. Many doctors use it, many doctors use it. Many doctors come here for themselves, and they doctors refer patients here. And they know that company cancer center has lots of advantages. They know the patients lots of communication, and it's close, and it's not alterated by lots of communications. A lot of advantages, presenting boutique type cancer concern, everything before my website, insurance, and so she's 90 years old. She's a single mother, and she had cancer of the adrenal gland. I was obviously about 4 years ago, and she's a oncologist and a doctor, specializing in doctor and oncology and medicine. And they always period and adrenal glands, for recruitment hospitals, and surgeons, they are maybe called just so much. So after adrenal robotic, well, that's just sold. But they ordered this robotic machine, and tried to get adrenal, and it's exploding that robotic machine. It's all over calamity, yes, it's calamity. 19 point. Surgery done with our cancer, cancer behind. Oh, here, no, the number of cancer spread all down the continents. Well, the opposite, solid, wow, and shortly thereafter, travel course, cancer, so a lot of people started cancer. Sometimes suffering after the tumor, so it's the tumor, later cancer of their lungs, and they went cut out their lungs. There was 19 year old girl, and this was compared to what was for cancer. So why they go left to do? Because they get paid for it. So I never did chemotherapy. So chemotherapy is great for everybody. Properties for the hospital, everybody, the patient, and the patient staff president of the year, 90 women, beautiful, that's right. And they have her belly, they have her belly cancer, not cancer, again, and again they live cancer behind that cancer, and then they cancer liver, and all these things, surgeries, mobile surgeries, chemo. I think working until she's about us. For a listener like you, she's actually seeing me for 2 years. Treating her slice cancer, focus cancer, cancer just out when the other treatments just didn't work. So I'm confused. I've already started. So everything. Liver therapy, it doesn't work, nothing. And so she came here, 54 months, and finally treated and when I got her well, so we understand. She got going, 54 months, chemotherapy, global operations, and biggest hospital in the lowest, hospital abdomen. Doesn't work, none of treatment worked until she came here. It's right in New York City, and this is what we do. And I'm not about you. I was talking to a lot of people, a lot of criticism. There's not much else expect to have radio treatment, but today, even this one with robotic surgery, open surgery, we're running rapid, and chemo, and it just hasn't worked. So a lot of reasons, every hospital names, every doctor, other things, every facility, standard treatment of one doctor, all the doctors on my call centers say there's a better way to focus on cancer and not hurt healthy structures. And that's how the surgery is all about. Non-invasive treatment is what we can't angles, but tapping into healthy structures. That's not unfortunately just abdomen, but chemo, and that's what we, that's so many people here. Cancer of the adrenal gland, kidney, bladder, gallbladder, prostate, lung, breast, every organ, this is working very hard to work. And lots of information we send you if you wish to call our office, say we not doing the brain cancer, body cancer, or if you have cancer, suspected cancer, just women, choices, 224 So they take like home, and 3 years ago, breast, outside the brain, and doctors moved it with lump, and with and do cancer. Size of the cancer, each border, and never got cancer, never got station. And took all kinds of precautions. Another big scans, so many precautions. B17, antibiotics, antioxidants, but secret. Then it's growing back, it's growing, it's suffered. So that's cancer, cancer, lower breast. That's what we know, so that's what we and offer cancer first, under also. First, the arm. This is also too, what we do. Our trade theme is that cancer is only these calories. It's what we have to treat, keep your body active, from cancer. So it's not mission is to take your life, that's all it knows. Our real mission is to stop cancer, to reverse cancer, really pain, really suffering, all non-invasively. So I supposed to feel the rest of the right arm, it's a massive, every left okay. So she got cancer and all the options came here for treatment. Finally she came years after options, see how nothing worked out better. That was such an international opportunity. This is what she said. She had to be she saw me, got insurance before sending this means cancer, all the time. So lots to do. Always many patients with cancer, which is not comfortable with the chaos in your life. Let's find and explain this every day here at the Right for in New York City. And there's only 7 years old on Florida, where said, why they chemotherapy for myeloma is toward the line. Jelly, he was pain, trouble with the bone, cause no pain. He was 93 pounds. He was another remarkable because messing abdomen, see if offer treatment, tries to help him. We see it. Because PSA usually is 0. Another good result after the And one patient from Ghana, lots of men, lots of men, cancer, more than 6 men get prostate cancer, more than 1 cancer. So lots of cancer, prostate cancer. In the Caribbean, 60 years old, son, 10, is in cancer. And you want to be your, this is the work every day, what else cancer, your life, sexual life, and his life. So good. I'm doing work.
results. And the organization has more. The things, and it's time to be she's so busy, she's so busy, she can't. 8 months after 40 days, because 3 days, 2 days, and plenty of time. And yet she said, no, she know that people with cystic cancer have high rates of cancer stage drop. I believe it's not visible. She's not perfect. It's not visible. I believe she needs to. She's treating cancer before cancer. And the second patient desire who refused to propagate cancer grew, not from the best finger versus equal with cancer. Cancer grows through the skin, big outside the red skin. Cancer elsewhere, body stage 4 cancer. So cancer, one thing, one opinion. I was 2 choices. 2, 4, 6, 4, 3, 7, 2, 4, 4, 2, 3, 7, appointment cancer, cancer. Not someone who's a serious chance to be cured. You know treatment, you're not likely to be cured. Not treatment, cancer, breast, with involvement. She refused therapy. She's saying 8 months ago, the best time to go treatment with the argument, surgery, all visible being supposed to be attack the area in my arm. Focusing on chemotherapy, focusing on surgery, mechanical removal, visible being high stress for cancer, kidney, prostate, bladder, units, do it, blood information, send you actual choices, call office 212 246 227. Go online at listeners-save-live.com because you can save live, listeners-save-live.com. Find me directly person emails, yelljail@rcsmi.org, yelljail@rcsmi.org. Stay tuned, learn, be smart, but do the measure.